the Catalans, the Basques, the Galicians in the Basque.
An independent future for Scotland.
How quickly do you think a referendum can be arranged?
Best practice demands that it should be 6 months.
Just looking at the overall share numbers for Scotland at the moment, the SNP 46.4%.
On the back of Gillian. Yeah, I knew that.
Good afternoon. Can I remind members that social distancing measures are in place in the Chamber and across the Holyrood campus, and I ask that members take care to observe these measures, including when entering and exiting the Chamber. And please only use the aisles and walkways to access your seat and when moving around the Chamber. The first item of business this afternoon is time for reflection. Our time for reflection leader today is Linda Britton, Celebrant, Humanist Society, Scotland.
Presiding Officer, thank you for inviting me to speak today at Time for Reflection. We should all know what that means, but do we take time to reflect? Some of us have busy lives, get caught up in what we feel is important without thinking of that what we do and say has an effect on others. As a humanist, I try to treat people as I expect them to treat me, to think before I act or speak, and just recently had to make a decision that I thought might upset someone. So why did I do it? And importantly, how? I engaged with the person, asked them to talk to me about their reasons, then asked them to listen to mine. We had a middle ground. Both of us felt listened to and respected for our different beliefs. I was able to conduct the ceremony for a person who did not have a faith, and their next of kin was able to lead the mourners in prayer after the ceremony closed. This was important to them. It was the right thing to do and benefited everyone. There is much debate in this chamber, rightly so. Our actions and words cause reaction in others. When we think before we speak, encourage discussion, try to walk in another's shoes, we become human beings that care. And as the people who have been elected to make decisions, it's important that this is foremost in your minds. If nothing else, the pandemic has shown us what is important. Look at Maslow's hierarchy of needs. Everyone needs a place to sleep, food, and to feel safe. As a human being, it's my responsibility and yours to work together to ensure no one is left without these basic needs. As John Donne wrote, no man is an island, and the pandemic has shown us that. And with COP26 taking place soon in Scotland, we can make changes that benefit all living creatures. We've lived through the worst year and a half that most of us can remember. I hope you've taken heart from the many people that have worked throughout without a thought for themselves. We applaud them. We can do better. We can show our gratitude by changing our behaviour, or as I mentioned at the beginning, reflecting on what we do and how we do it. Thank you for listening. It's been a privilege to speak to you.
Thank you. Thank you. The next item of business is consideration of business motion 1227 in the name of George Adam on behalf of the Parliamentary Bureau, setting out a change to today's business. Any member who wishes to speak against the motion should press their request to speak button now. And I call on Stephen Kerr to move the motion.
George, I am happy to move the motion.
Thank you. No member has asked to speak against the motion. Therefore, the question is that motion 1227 be agreed. Are we all agreed? The motion is therefore agreed. The next item of business is topical questions. In order to get as many people in as possible, I'd be grateful for short and succinct questions and responses. As I call Graham Simpson.
Thank you, Presiding Officer. To ask the Scottish Government what its response is to the announcement by the UK Government not to proceed with plans to introduce vaccine passports.
Cabinet Secretary John Swinney.
Presiding Officer, we know from expert public health analysis that we must do all that we can to stem the rise in cases and reduce the pressure on the National Health Service. Vaccine certificates have a role to play as part of the wider package of measures. They add a further layer of protection in certain higher risk settings. We propose a very limited scheme to allow businesses to remain open and prevent further restrictions as we head into autumn and winter. The measures we take forward have got to be effective, but they have equally got to be practical and able to be delivered. We will work with all of the relevant sectors that are affected in a constructive way to make sure that we implement the decision that Parliament has taken in principle, that it wants to see a vaccine certification scheme in place.
Graham Simpson.
Well, can I thank the Deputy First Minister for that answer? He didn't actually answer the question that I asked, but we'll move on from that. At the weekend, the head of the SPFL, Neil Doncaster, said the League was hugely concerned about the practicalities of delivering the scheme. After the League made it clear that the government's plan was unworkable, the Health Secretary confirmed that Mr Doncaster's suggestion of spot checks on those attending a match was a possibility. That shows this government is still filling in the blanks when it comes to this scheme. Now, one of the many questions still remaining is around data and the equipment used. In the debate last week, much was made of the fact that businesses will be able to use an app on a phone to scan QR codes. And when I asked the Minister for Parliamentary Business earlier on today what data would show up on somebody's personal mobile phone, say outside a football ground, he couldn't say. So if my name, address and date of birth were to show up, that would be a clear breach of data protection laws. These details could be easily harvested.
Can I have a question, please,
the question
Mr Simpson?
is, so what protections would be put in place to prevent this happening?
Cabinet Secretary.
I think it's interesting that Mr Simpson moved on his question, and instead of pressing me for further detail on the United Kingdom Government's position, and he might have done that because, of course, the United Kingdom Government has just confirmed to the House of Commons that they intend indeed to take forward a vaccine-only certification scheme in nightclubs, in indoor crowded settings with 500 or more attendees, in outdoor crowded settings with 4,000 or more attendees, and any settings with 10,000 or more attendees, should the circumstances arise because of the level of the pandemic. That is exactly the situation we face. We've been open with Parliament. It's very obvious that we've got a very significant level of caseload just now, which is putting huge pressure on the National Health Service. Hence, our rationale for bringing forward a mandatory vaccine-only COVID status certification scheme, which is exactly the same position that the United Kingdom Government is taking forward. Now, of course, I can understand why Mr Simpson is skating past this, because it's been, frankly, a very confused 48 hours on this question from the UK Government. Now, on his substantive... Mr Kerr says this is the Scottish Parliament. I've just been asked a question by one of his own backbenchers about the United Kingdom Government, and I'm just trying to be as fabulously helpful as I always am when I'm answering questions. Now, on the point that Mr Simpson was raising about what information will show up when a QR code is being analysed, the data that he's talked about will not show up when that's the case. Because he's right, that would be a clear breach of data, and there's no harvesting of data involved here. It's simple checking of information contained in a QR code to verify that somebody has been double vaccinated, to try to keep us all safe.
Graham Simpson.
Well, of course, the difference between the UK Government and the Scottish Government is the Scottish Government has actually set a date for introducing this, and the UK Government hasn't. It said if circumstances arise. There's a big difference there, and the Deputy First Minister knows it. It's been almost 2 weeks since the First Minister announced the plan for vaccine certification, but the Health Secretary again said yesterday they were still working on the definition of a nightclub. So does the Deputy First Minister see how ridiculous it is that this scheme is going to come into force in a matter of weeks and the Government still can't provide any clarity on key questions surrounding its implementation?
Cabinet Secretary.
Well, one of the many points of similarity with the UK Government here is that our decision-making is based on the circumstances. We have a very high prevalence of COVID, and it's driving hospital admissions today. There are 1,064 people in hospital today with COVID-related illness. That's a very high level, comparatively very high. So we're having to take the action in the timescale that we're setting out because the circumstances have arisen here. And then on the question of the definition of nightclubs, the Government is working with the Nighttime Industries Association to be certain about the details of that definition. We are working through individual questions with the Nighttime Industry Association to ensure that we address any unintended consequences within that definition, and of course we'll publish that when we've come to the conclusion of that exercise.
Jackie Bailey.
So this week is Freshers' Week. Students will be congregating from all over the world and the UK in pubs, in cafes, in restaurants, and indeed for the next 2 weeks students from outside Scotland will be in nightclubs. On the 1st of October, they won't be able to do so because they've been vaccinated outside Scotland, and NHS Scotland does not recognise their vaccinations for the purpose of certification. The problem has been there for months and has not been fixed. Can the Cabinet Secretary confirm to this Chamber that it will be fixed in the next 2 weeks?
Cabinet Secretary.
Well, we're obviously working to address a number of practical issues to ensure that the steps that we take forward are effective. But we fundamentally come back to the core motivation behind this particular move. The core motivation is to try to reduce the level of transmission that is possible because of the protection of double vaccination, and by trying to make higher risk settings safer as a consequence of the vaccine certification approach. That's the policy objective that we're trying to secure. I quite appreciate that that will mean that some people are unable to access nightclubs because they will not have vaccine certificate, or they won't have adequate vaccine certification in place. But the purpose of this is to try to reduce transmission by maximising the level of protection that's in place within the population.
Stephen Kerr.
Thank you, Presiding Officer. The Government seems to be shifting its position in light of its its discussions with the industry. I think it's only fair to press the Deputy First Minister in respect to the answer he gave some moments ago to my colleague. When exactly does he expect to be able to bring details to this Chamber and to publish them more widely?
Well,
Cabinet Secretary.
I think the first point I would make is that Mr Simpson, actually I should have addressed this, my apologies to Mr Simpson, I didn't address this point he made earlier. He talked about the possibility of spot checks and suggested, at football grounds, and suggested that that was some new development. That was conceived of in the document we lodged with Parliament last Thursday. So it shouldn't have been a surprise when the Health Secretary talked about it on radio at the start of the week. In relation to Mr Kerr's point, the government often gets criticised for, in the eyes of some of our critics, not engaging enough with external sectors. Now we're getting criticised for engaging too much with sectors. We want to make sure that we get a definition, as I explained in my response to Douglas Ross last week, that we don't have a definition that essentially creates any uncertainty or disadvantage within the marketplace around the grey area between nighttime pubs and nightclubs. And we just have to make sure we get all of those details thought through in consultation with the industry, and we'll publish that information as soon as we've completed those discussions.
Question number 2, Gillian Mackay.
Thank you, Presiding Officer. To ask the Scottish Government whether it is in discussions with the UK Government regarding its decision to terminate its supply agreement with Valneva for its COVID-19 vaccine candidate VLA 2001.
Cabinet Secretary Hamza Youssef.
The decision to terminate Valneva's contract was one taken unilaterally by the UK Government. We are in discussions with the UK Government over Valneva's alleged failure to meet the terms of its contract, and we are awaiting further information. We're currently working with Valneva to secure the future of the site, and the Minister for Business, Trade, Tourism and Enterprise, Ivan Mackay, will be meeting with them shortly to discuss matters. The announcement to terminate the contract does not affect the Scottish Government's vaccination programme, which we continue to roll out as guided by advice from the JCVI, and the First Minister will give details of that shortly. We have sufficient vaccine supplies to undertake any potential booster programme over the coming months.
Gillian Mackay.
Many people in Scotland participated in clinical trials of the Valneva vaccine, and this decision may understandably cause them anxiety about their vaccination status. Can the Cabinet Secretary confirm that the termination of the agreement will not impact the vaccination status of anyone who participated in the Valneva clinical trial?
Cabinet Secretary.
I will take a look at that, but yes, of course, we wouldn't want anybody disadvantaged if they took part in a vaccine trial. We owe them a great deal of thanks. And I'm not talking specifically about Valneva because I don't have the details from the clinical trial, but I will urge the UK Government to publish that detail because I think transparency in this matter is absolutely paramount. So yes, I will go away and take a look at that to double check, but is the Scottish Government's starting position that anybody taking part in a clinical trial should not be disadvantaged in any way, shape or form.
Gillian Mackay.
I thank the Cabinet Secretary for that answer. There is some evidence that the Valneva vaccine could be more effective against variants than other vaccines. What impact does the Cabinet Secretary think the UK Government's decision could have on our ability to protect people against further mutations of the virus?
Cabinet Secretary.
Again, I will reiterate what I just said a moment ago, that I think it would be important in the interests of openness and transparency that the UK Government publish, absolutely when appropriate, because I know there are sensitivities and commercial sensitivities around these matters, but publish the results of the COVID boost trial and the clinical trials underway. What I would do is reiterate, regardless of this decision, we have plentiful supply of vaccine, and I'm pleased to say that the clinical trials and the evidence we have show that, of course, the vaccines we are using are very effective in relation to reducing the severity of illness against COVID, and including the Delta variant.
Fiona Hislop.
Valneva employs constituents of mine, and he'll be aware that Angela Constance, MSP, and Hannah Bardell, MP, have written to the UK Government asking them to provide transparency about the UK Government's decision-making and their ongoing investment commitment to the West Lothian cited French-owned facility. As Scottish Enterprise have also supported the company, will he ask the Business Minister, when he meets with the company, to discuss their worldwide vaccine market opportunities and this situation?
Cabinet Secretary.
Yes, I will do, and I agree with everything that Fiona Hislop has said. I have spoken to both Angela Constance and Hannah Bardell yesterday. I'm more than happy to speak in detail with Fiona Hislop and any other interested member. But we certainly, as a government, will do everything we can to ensure that we can provide as much security for the site as we possibly can. And as I say, I'm happy for my colleague, the Minister for Business, Trade, Tourism and Enterprise, to update the member once he's had those discussions.
Sarah Boyack.
It's very welcome to hear from the Cabinet Secretary that this should not impact on access to vaccines. Does that also include the possibility of 12 to 15-year-olds being given vaccinations and older people getting boosters? And does that impact on the surplus that he's referred to? Would that impact on the possibility of the Scottish Government supporting people going to COP26 from low-income countries being able to access vaccinations?
Cabinet Secretary.
I suppose the answers would be yes, yes and no to her answer, to her question. So we have plentiful supply. The First Minister will outline shortly our response to both the CMO's advice and JCVI's advice in respect to 12 to 15-year-olds and the booster programme respectively, but we have plentiful supplies, even if we include those two possibilities within our future programming. And no, the decision by the UK Government won't impact our decisions to be able to vaccinate those from the developing world who may be coming to COP26. So there is plentiful supply, and I just want to reiterate and reassure for our future vaccine rollout programme with all the possibilities that we are planning for, we have plentiful supply.
Thank you. That concludes topical questions. Point of order, Martin Whitfield.
I'm very grateful, Presiding Officer. With regard to topical questions, the first related to vaccine passports, and there was great interest in adding additional questions to seek clarification on this matter. Could I ask for your advice on how we can persuade the Government to come and give a ministerial statement on this so that the significant number of outstanding matters could be answered, please?
Thank you. The member may be aware that there was discussion at Bureau amongst business managers. Such discussion will continue. It is a matter, of course, for the Government as to whether or not a ministerial statement is made. I now moved on to the next item of business, which is a statement by Nicola Sturgeon on COVID-19 update. The First Minister's statement will be followed by questions, and so there should be no interventions or interruptions. And I call on Nicola Sturgeon. First Minister.
Thanks, Presiding Officer. I will give an update today on the latest COVID situation. I can confirm that the Cabinet met this morning and decided not to make any immediate changes to the current regulations in place. I will also give an update on certain other issues, most notably the mitigations in place for schools, including, of course, our approach to vaccination of 12 to 15-year-olds and the issue of a vaccine booster programme, which we have received final JCVI advice on this morning. Firstly, though, to recap on today's statistics, 3,375 cases were reported yesterday, 11.4% of all tests. 1,064 people are currently in hospital with COVID, 16 more than yesterday, and 89 people are receiving intensive care. That is one fewer than yesterday. Sadly, a further 21 deaths have been reported in the past 24 hours, and the total number of deaths under the daily definition is now 8,263. And as always, I send my condolences to everyone who has lost a loved one. Good progress continues to be made in the vaccination programme. As of this morning, 4,144,904 people have had a first dose and 3,788,551 have now had both doses. 95% of people over 40 are fully vaccinated with 2 doses now, as are 73% of 30 to 39-year-olds and 60% of 18 to 29-year-olds. Around 76% of 18 to 29-year-olds have, though, had a first dose, so the proportion in that age group who become fully vaccinated will continue to increase in the weeks ahead. In addition, 65% of 16 and 17-year-olds have now had the first jab, which is 5 percentage points higher than at this time last week. Presiding Officer, although the level of infection in Scotland remains too high, there are continuing signs that the recent spike in cases is now slowing down. Indeed, we're now seeing early signs, not just that the rate of increase is slowing, but that cases are now actually starting to fall slightly. This can be seen in the last 3 weeks' data. In the week to 28th August, there were an average of 5,651 new cases a day, which was an increase of more than 80% on the previous week. In the week to 4th of September, average daily cases were 6,290, still an increase, but one of just 11%. However, in the 7 days to the 11th of September, so the most recent 7-day period, cases have fallen to an average of 5,506 per day, which is 12% lower than last week. It might also be worth providing some detail on the age breakdown of cases. In the past week, more than 70% of cases have been in the under 45s, and that's consistent with the pattern we've seen throughout this latest wave. However, the picture varies across different age groups. That said, there are broadly positive signs now in all of them. 2 weeks ago, in the week to 4th September, the number of cases in the 0 to 14-year-old band rose by 51%. However, in the past week, cases in that age group have fallen by 5%. Amongst 15 to 24-year-olds, cases fell by 16% 2 weeks ago and have now fallen even further by 34% in the most recent week. 2 weeks ago, cases in the 25 to 44-year-old age group rose by 7%, and last week they fell by 14%. Finally, the number of cases amongst the over 65s has risen slightly, but again the rate of increase has slowed down over the past week. So this most recent data underpinned Cabinet's decision earlier today not to reintroduce any restrictions. I'm very grateful to everyone, organisations, businesses and individuals who has taken extra care in recent weeks to try to stop this spike. It does seem that these efforts are making a difference. That said, of course, our position does remain challenging. Even though new cases have fallen, they remain 5 times higher than at the start of August. Universities are now returning for a new term. That is very welcome, but it also creates some additional risk, and I'll say more shortly about how we are working to mitigate that risk. Overall, though, the key point is this. The recent fall in cases is very welcome, but we cannot take it for granted. We must continue efforts to keep cases on a downward track. The NHS is already under considerable pressure, and any further rise in cases would intensify that. As we know, vaccination has significantly weakened the link between cases of COVID and serious health harm from COVID. The proportion of people with the virus who end up in hospital remains much lower now than before the vaccine programme started, but current case numbers reflect how transmissible the Delta variant is. So, as we can see already, even a lower percentage of a large number of cases results in a high number of hospitalisations. To illustrate that, on 20th August there were 312 people in hospital with COVID. Today there are 1,064. The number in intensive care has also increased from 34 on 20th of August to 89 today. Of course, these figures do not include people who don't need hospital care but nevertheless suffer long COVID. It's also important to remember that the pressure that the NHS is experiencing falls on staff who have in many cases been working flat out since the start of this pandemic. And it comes at a time when the NHS is working to catch up on a backlog and care for everyone who needs it, not just COVID patients. The Government continues to work closely with health boards to help manage these pressures, but as has been the case throughout the pandemic, everyone has a role to play. At the start of the pandemic, we constantly emphasised the need to protect our NHS. That is still necessary and should give all of us even more incentive to get vaccinated, test regularly and take all the basic precautions that we know can slow down transmission. An additional reason for continued caution is that it helps protect those most at risk. The UK Government announced earlier today that it will no longer use its shielding patient list. In light of that, and to avoid any mistaken assumption, it's important for us to confirm that the Scottish Government is not following suit at this stage. We will continue to use our equivalent list, which is the highest risk list. We have used this throughout the pandemic to communicate with all those at highest risk and ensure that they have advice and support. We will continue to keep this under review, but for the moment we believe it is important to retain it. I'll now provide a brief update on some specific strands of work. Firstly, I can confirm that Cabinet Secretaries are continuing to engage with representatives from business, the public sector and wider civic society to encourage maximum compliance with the mitigations still in place. I'll be taking part in a round-table meeting with a range of stakeholders immediately after this statement to underline the importance of this work. I am again grateful to all businesses and organisations for the efforts being made to follow and promote measures like the wearing of face coverings, good ventilation and hygiene, and wherever possible, continued home working. In addition, as I mentioned earlier, the university term is now starting. Colleges began their return a few weeks ago, and we've been working closely with universities, colleges and the wider sector to make the return as safe as possible. As a precaution at this stage, colleges and universities won't be holding large in-person lectures for now. Instead, there will be a mix of online and in-person learning, with institutions themselves deciding the level of in-person teaching that they will offer during this term. In addition, physical distancing will remain in place on campuses and face coverings will be required in indoor public spaces. We're also, of course, encouraging students to get tested regularly. Test kits are available on campuses, and students who are moving to term-time accommodation should book a PCR test before making that move. Above all, we are strongly encouraging students to get vaccinated if they haven't done so already. Mobile vaccination units are being deployed in universities and colleges during Freshers' Weeks, and vaccination will continue to be made available throughout the term. Health Board web pages will contain details of local drop-in clinics and also clinics operating within colleges or universities. We're also continuing to work with local authorities to make schools and childcare centres as safe as possible, for example, through support for the use of carbon dioxide monitors and improved ventilation. We have also received further advice from the advisory subgroup on education, and I want to take the opportunity today to highlight 2 points arising from that advice. First, we indicated at the start of term that secondary school pupils would need to wear face coverings in class for the first 6 weeks of term, subject to a review at that point. Given the continuing high levels of infection still being experienced at this stage, the advisory subgroup has advised that this requirement should remain in place until the October holidays and be reviewed again then. I know how unpopular this is with many pupils, and I completely understand why, but for now it remains a prudent and a necessary precaution. Second, we intend to clarify an aspect of guidance on contact tracing in schools to help ensure fuller understanding of the process. There is no change in advice for close contacts thought to be at high risk of having COVID. They will continue to be advised to self-isolate until they have returned a negative PCR test. For children and young people, a high-risk contact is most likely to be a household member or someone they have stayed overnight with. However, we will clarify guidance on the letters that schools send to lower-risk contacts. These letters should be sent on a targeted basis to those who are most likely to have had low-risk contact with someone who has tested positive. They ensure that parents, staff and pupils are aware of those cases, and the letters offer advice on issues like looking out for symptoms and using lateral flow testing. Our updated guidance may mean, for example, that it is appropriate to send letters to the classmates of a pupil who has tested positive, but not necessarily to everyone in their year group. We hope that better targeting will help reinforce the importance of the messages in these letters while minimising undue anxiety. In addition, the advice in the letters will be strengthened in one respect. They will recommend to primary and secondary school pupils and staff who receive them that a lateral flow test is taken before the next return to school. That test should be in addition to the regular twice-weekly lateral flow testing, which is recommended for all secondary school pupils and staff. Presiding Officer, all of these measures reflect our commitment to prioritising the well-being of children and young people and our determination to minimise disruption to education. That consideration was also, of course, central to the advice that the Scottish, Welsh and UK governments and the Northern Irish Executive received yesterday from our Chief Medical Officers. Members will recall that the JCVI had concluded that the benefit of vaccination, the health benefit for 12 to 15-year-olds, did outweigh any risks, but that because this was marginal, they could not recommend a universal offer of vaccine to this age group on health grounds alone. However, they indicated that it would be appropriate for Chief Medical Officers to consider whether any wider issues might tip the balance in the other direction. The CMOs have now done so and concluded that vaccination could reduce disruption to education, and that, taken together with the health benefits previously identified in the JCVI advice, extending the offer of vaccination to all 12 to 15-year-olds is justified. Taking this broader view of the benefits and risks of vaccination, the CMOs are recommending that 12 to 15-year-olds should be offered 1 dose of the Pfizer vaccine. This advice has been broadly endorsed by the Royal College of Paediatrics and Child Health. I'm very grateful to all of the 4 Chief Medical Officers for assessing the evidence on this issue with such pace and also with such rigour. I can confirm to Parliament today that the Scottish Government welcomes and accepts this recommendation. We believe that vaccination of 12 to 15-year-olds is important, and we will therefore move to implement the advice as quickly as possible. Our supplies of vaccine are adequate to allow us to do this. It is, of course, important to stress how important informed consent is. I know that many young people and their parents will have questions. Material will be made available online later this week. It will be appropriate to both young people and adults. It will seek to answer questions and provide balanced information to help young people and their parents make informed choices. And I can confirm that from Monday, 20th September, so Monday coming, drop-in clinics will be open for any 12 to 15-year-old who has read the information and, in discussion with parents and carers, decided that they do wish to be vaccinated. It will, of course, be appropriate for parents or carers to accompany their children to clinics, and vaccinators will be on hand to answer any further questions or address any concerns. And then, starting in the following week, so week beginning 27th September, letters will be sent to all 12 to 15-year-olds, inviting them to an appointment at a drop-in centre or vaccination clinic. Again, parents and carers will be invited to accompany their children, and again, the appointment will include an opportunity to ask questions and discuss concerns. Finally, after the scheduled community sessions, there will be a programme of vaccination in schools to ensure that anyone who hasn't been vaccinated and who decides that they want to be gets a further opportunity. Presiding Officer, I know that these are important decisions for young people and their parents, and that many will have questions. I would encourage everyone to read the information that will be provided, and do not hesitate to visit a drop-in clinic to ask any questions or raise any concerns. Vaccination is a vital part of our overall protection against this virus. That is why it is important to support people, perhaps especially young people, to make informed choices that they feel comfortable with. In addition to the CMO advice on 12 to 15-year-olds, we have received this morning the final JCVI advice on a vaccine booster programme. This is in addition to the 3rd doses already being offered to people who were severely immunosuppressed or immunocompromised at the time of their 1st or 2nd vaccination. I can confirm that the Scottish Government is also accepting this advice, and again we have adequate supplies to move ahead with this. The booster programme is intended to prolong the protection that vaccines provide against severe COVID illness. It will run alongside our biggest ever flu vaccine programme, since, of course, both of these programmes are important for individual and for public health. Wherever possible, eligible people will be offered COVID and flu vaccines together. Booster vaccines will be offered to all adults over 50, to frontline health and care workers, and to younger adults with certain health conditions that put them at higher risk, and to adult household contacts of people with suppressed immune systems. The JCVI has also advised that there should be an interval of at least 6 months between a 2nd dose and a booster dose. So let me now give a broad outline of the order in which we will now move to implement the booster programme, and of course we will set out more details shortly. Frontline health and social care workers will be able to book their booster appointment online through NHS Inform from Monday, 20th September, so that again is Monday coming. Also from next week, residents in care homes for older people will be offered both flu and COVID booster vaccines. Adults aged 70 or over and everyone aged over 16 on the highest risk list will be contacted very shortly, either by letter or by their GP. Other eligible groups, that's all adults over 50, all those 16 to 49 with underlying health conditions, adult carers, unpaid and young carers, and adult household contacts of people who are immunosuppressed will be able to book online from October. These two announcements today, Presiding Officer, represent a very significant and a very welcome extension of the vaccine programme, and they will help us considerably in our ongoing efforts against this virus. So to anyone eligible for vaccination, please do take up the opportunity. The final point about vaccination I want to touch on very briefly is certification for certain venues, which of course Parliament approved in principle last week. We are now working with businesses, events organisers and sports governing bodies to finalise the detail of the regulations and sector-specific guidance. COVID certification has of course already been introduced in many countries across Europe. Indeed, many of them have already gone much further than we are proposing. We know that this is not a magic wand, but we do believe that as part of a package of measures, it can help reduce transmission while keeping our economy and our society open, which is of course what all of us want to see. Presiding Officer, I'll close by emphasising again the key things all of us can do to help and to ensure that we keep infections on a downward track. Firstly, as I've already been talking extensively about, please get vaccinated if you are eligible and you haven't yet done so. Secondly, please continue to test yourself regularly with lateral flow devices. You can order these through NHS Inform or collect them from a local test site or pharmacy. And if you test positive or you're identified as a close contact, or if you have symptoms of COVID, please self-isolate and book a PCR test. And thirdly and finally, please continue to comply with the mitigations still in place. Please wear face coverings in indoor public places such as shops, public transport and when moving about in hospitality settings. Think carefully about the number of contacts you're having and perhaps reduce any that are not strictly necessary. Meet outdoors as much as possible, indoors, open windows if you can, and although it's not the law anymore, try to keep a safe distance from people in other households, especially when you are indoors, and remember to continue to wash your hands and surfaces thoroughly. All of this, as we can see in the most recent data, really does make a difference. So please stick with it and let's get cases down even further. Thank you, Presiding Officer.
Thank you. The First Minister will now take questions on the issues raised in her statement. I intend to allow around 40 minutes for questions, after which we'll move on to the next item of business. It would be helpful if members who wish to ask a question were to press the request to speak buttons now. And I call Douglas Ross.
Thank you, Presiding Officer. It's good to hear that cases are down week on week, but our NHS continues to face considerable pressure. We've seen long waiting times for ambulances and lengthy queues for people to see their GP. Even if the First Minister won't accept it, our NHS is in crisis and our health service needs more support. Today, on top of all of the issues facing our NHS, figures on suspected drug deaths were published that are once again shocking and heartbreaking in equal measure. After 7 consecutive years of record drug deaths here in Scotland, the problem still seems to be getting worse. When will the First Minister and her government finally tackle this national scandal? Turning to the announcements on vaccines being delivered for 12 to 15-year-olds and booster jags, both of these measures have the potential to be game-changing in halting the spread of COVID this winter. But we need some more answers on the delivery of these schemes. The First Minister mentions drop-in clinics for young people. Will there also be mobile vaccination units at every school to encourage uptake, particularly in areas where vaccination rates are low? On booster jags, the First Minister said the programme will run alongside the existing flu programme, but are there also plans to use mass vaccination centres? On vaccine passports, the First Minister says she is finalising the detail and is, I quote, now working with business. Why didn't this happen weeks ago? And finally, the First Minister told us that the Cabinet decided this morning not to make immediate changes to COVID regulations. What restrictions did her Cabinet consider reintroducing? Thank you.
First Minister.
Cabinet didn't consider any additional restrictions this morning because the data that I have narrated suggested that cases are starting to fall. We keep these things under review on a weekly basis. We'd be deeply irresponsible not to do that, but the decision of Cabinet today is that it was not necessary to introduce any further restrictions at this stage. Let me quickly run through the other points, Presiding Officer. Firstly, forgive me if I heard wrongly. I was struggling at points to hear Douglas Ross, but I think he said at one point that I didn't accept that there was pressure on the National Health Service. Not only do I accept that there is pressure on the National Health Service, I spend a significant, considerable amount of time, as indeed the Health Secretary does, reminding people of just how much pressure there is on the NHS and why it is so important for government to do everything through resources and support for health boards and cooperation and collaborative working with health boards to support those on the front line of the NHS, but also why it's important for all of us to behave in a way that reduces COVID cases and therefore tries to help alleviate that pressure. And it's also why, while none of us like these things, we are or would be irresponsible not to take advantage of all of the different levers that we have at our disposal to try to push cases down, and that includes, of course, COVID certification. On the issue of drugs deaths, this government takes that extremely seriously. Douglas Ross may not agree with this, and as is his right, but there is a significant package of work underway right now, backed by significant additional resource to tackle drugs deaths. The Drugs Minister, who reports directly to me, is overseeing that on a daily basis. It involves and includes new standards for treatment, to include same-day access to treatment, a wider range of treatment options, more funding for community organisations, more funding for rehabilitation, including residential rehabilitation. So we will continue to take the action that is necessary to bear down on those unacceptable figures. In terms of the questions about vaccination, obviously we received the CMO advice on 12 to 15-year-olds yesterday. We've received the JCVI advice on the booster programme this morning. There will be more or finer, more granular detail available in the coming days. But we are giving today the start date for 12 to 15-year-olds and indeed the start date for the booster programme, which is Monday coming. Drop-in clinics are already available right across the country. There's drop-in clinics in every mainland health board area. These will be available from Monday for young people. There will then be appointment letters issued with specific appointments for those who don't take advantage of a drop-in. And then we will use school vaccination to make sure we're reaching as many as possible. The judgment has been made is that in order to facilitate and support maximum informed consent and involvement in parents and carers, using clinics and appointments in the initial stages is better than to do that through schools initially. But our aim is to get to as many as possible and encourage as many in that age group to take up the offer of vaccination. And we'll use all of the existing resources, mobile clinics and all of the other resources we're using to maximise uptake as far as possible. Lastly, sorry, I think there was a point about flu vaccination and mass clinics. The flu vaccine programme will be delivered through a combination of GPs and vaccination clinics. Not every health board will do that exactly the same, but the flu vaccination programme will start first together with the booster COVID vaccine in our older residents' care homes. This is a massive undertaking for health boards, but given how well they have so far progressed the COVID vaccination programme, I think we should all have great confidence in their plans to deliver the next stages of that with flu vaccination. And lastly, on businesses, we work with businesses on an ongoing basis. We will continue to do that. None of us want to be in a situation where we still have to deal with this virus, but it is important that we do that resolutely, and we continue to do all of the things we're doing right now to keep that downward pressure on cases.
Anna Sarwar.
Thank you, Presiding Officer. And can I start by sending my condolences to all those that have lost a loved one in the last 24 hours or indeed throughout this pandemic. The route to something that looks like normal again for Scotland remains through testing, tracing and vaccination. Last week I called for frontline NHS and social care workers to be included in the early booster programme. I am pleased to hear today that that will be happening. But given the high levels of cases in schools, surely that should also include teachers and support staff. I also highlighted concerns about Test and Protect not functioning in our schools, and I welcome movement on that today, but there is still work to do. I think we will look back and think pulling back Test and Protect was a catastrophic decision. I note there is still no detail on how vaccine passports will operate, yet we are expecting businesses and individuals to implement them in just 2 weeks' time. Instead, the focus should be on strengthening our existing systems. Test and Protect is still failing to meet World Health Organization standards. It is as low as 60% in some areas. And I also noted last week the First Minister referenced 72 hours from when they log on the system. I think that's a pretty heavy caveat. Also note that the average number of primary contacts per case has fallen to 1.5. That's the positive case and half a person. Just a matter of weeks ago, that figure was 3.4. So will the First Minister commit to fixing Test and Protect and supporting the staff than rushing through an ineffective new system? The Scottish Government has also been saying that it's been planning for months, rightly, for the rollout of vaccinations for 12 to 15-year-olds. So the news that letters are only going to go out from the end of this month is a bit disappointing. As we get to those harder to reach people, we should not be asking people to go to vaccination centres, but rather asking the vaccination centres to go to people. So will she commit that every child that wants a vaccine will be able to get it, that they can get it at school, and that they should get it before the October holidays? We should not miss that opportunity. Surely that should be the plan if it's been in the planning for months.
First Minister.
Firstly, on 12 to 15-year-olds, because it is probably the most important issue we're covering today, we received the final advice yesterday. Any 12 to 15-year-old who wants to be vaccinated will be able to be vaccinated from Monday. That is less than a week. Why is there a few days in between? Because we've got to make sure, taking account of the final advice, which we only got yesterday, we make available the information that young people themselves and their parents and carers will want to consider before making an informed choice. So that's why there's a few days before vaccination will start. But I think most reasonable people, which may or may not include Anas Sarwar, will think that that is a pretty speedy start to that programme. We have taken a judgment that in the initial stages it is better to use drop-in clinics and vaccination appointments because that better facilitates the involvement of parents and carers in the decisions and in accompanying young people to their vaccine so that questions can be answered and concerns addressed. But yes, every young person, and actually doing it this way will be quicker than trying to put effectively a new programme in place in schools. Doing it through the mechanisms and the infrastructure that's been available now for most of this year will actually allow us to get underway with this more quickly. We will then use school vaccination to make sure that nobody is losing out on the ability to be vaccinated. So having spent a fair bit of time with the Health Secretary looking at these plans in detail, I think this is the best and the quickest way to proceed. On the booster campaign, Anas Sarwar says that he would like teachers to be included. Teachers that are in the over 50 age group or in the under 50 age group with particular underlying health conditions, of course, will be included. But I suppose the key point of difference here between Anas Sarwar and I is, and perhaps it's because I have the responsibility of implementing these decisions, we have to base them on expert advice. We have to base them on the recommendations that come from those who have the expertise to give us those. I am a politician. It is not for me to second-guess the experts when it comes to vaccination. And lastly, on Test and Protect, penultimately on Test and Protect is functioning well. When cases are high, it is under significant pressure, and we support it to do that. As cases reduce, as they are now, thankfully, that pressure will reduce as well. Test and Protect has never stopped functioning in schools, and it is not correct to say that it has. It is functioning on a more targeted basis in order that it can protect people from the risk of infection without undue and unnecessary disruption to young people's education. And I think that is an important aim to have. And lastly, vaccine certification is not instead of doing all of the other things, it's in addition to that. Because one of the things we know and one of the things we've learned is you need to use all of the levers at your disposal to bear down on cases to the maximum effect. So we will continue to take proportionate, targeted action to keep cases coming down and hopefully get through this winter without the need to impose any restrictions and to keep our economy and our society open.
Alex Cole-Hamilton.
Thank you, Presiding Officer. Can I say for the record that COVID ID cards must be ruled out for children because there should be no external pressure on families when deciding about the vaccine. Presiding Officer, last week the First Minister lent into the words of Professor Stephen Reicher to justify this ID card scheme, but he's actually against it. She implied that events industry, Jeff Ellis, supported it too. He does not. In fact, he told me today, and I quote, "I'm prepared to support a drive to encourage young people to get the vaccine, but that is different to saying you are going to exclude them if they don't." The First Minister is running out of experts to quote. So will she cancel COVID ID cards for all age groups today?
First Minister.
No, I won't, because I think it is really important that we don't rule out measures that many people accept. And even Steve Riker, who, yes, on balance, has decided that he doesn't think they're a good idea, he recognises that they do have advantages and that there are benefits. And I think when we're facing a situation right now where cases have been high, where we are
Sorry, First Minister, I am finding it difficult to hear the First Minister. I'd be grateful if we could all hear the First Minister.
Where we are desperately trying to keep cases under control while keeping our economy open. I think it would be a foolish government that simply ruled out anything that... I mean, if you look at the SAGE position, they recognise that vaccine certification can play a part in reducing transmission. And indeed, after a fanfare at the weekend of suggesting that it had ruled them out, the UK Government has been very clear today that it is keeping the option of vaccine certification open, and even without doing it on a mandatory basis, are encouraging venues to do it voluntarily. So I think it's really important that we do not limit our options here, because we want to get through this winter with everything open and with cases at a manageable level. And that's what we will continue to try to do. And I make no apology for that. Of course, we'll continue to involve Parliament fully in the detail of it.
Stuart McMillan, to be followed by Sharon Dowie.
Thank you very much, Presiding Officer. Can the First Minister provide an update on the work being conducted to establish an independent public inquiry into the handling of the coronavirus pandemic in Scotland?
First Minister.
Well, we will continue to work across the education sector to make sure that we take all appropriate actions to support the safe return of teaching, to ensure that physical distancing remains in place, that face coverings continue to be used and that vaccination continues to be encouraged. There is an opportunity over the next few weeks to really maximise the uptake of vaccination and to use testing to full extent as well. And there is a big responsibility on the part of everybody here to make sure that everything possible has been done to reduce the risk of outbreaks in the weeks to come.
Sharon Dowie, to be followed by Christine Graham.
Thank you, Presiding Officer. As the First Minister will know, this week NHS Ayrshire and Arran have elective surgeries and suspended visiting unless essential. A&E has reached breaking point. I've also been contacted by staff at Crosshouse Hospital who say cancer operations have been cancelled due to a lack of beds, while nurses are quitting the profession due to chronic understaffing. The First Minister has boasted of how many nurses we have, but staff at NHS Ayrshire and Arran feel angry, unsupported and let down. What action will the First Minister take to improve staffing levels at Crosshouse, and can she guarantee that all cancer treatment at NHS Ayrshire and Arran will resume by the end of the month?
First Minister.
Well, firstly, let me take the opportunity again today to express my gratitude to everybody, nurses and everybody else working so hard across the National Health Service. We do have a record number of staff in our health service. That includes nurses, but of course we need to do more to support them. We have a commitment over the period of this Parliament to further increase those working in our National Health Service. We'll continue to work closely with health boards to make sure that they are supported to minimise any need to postpone or cancel elective treatments, to make sure that the most urgent treatment and cancer treatment, of course, as part of that definition, continues as people need it to do. But there is a real fact at the heart of this. If we are to get our NHS back to normal, which everybody is working hard to do, we need to get COVID cases coming down further and keep COVID cases down. And therefore, and it perhaps is a comment that is particularly relevant to those in the Conservative benches, we need to be prepared to take the action that gets COVID cases down. I think over the past few weeks, almost everything we've proposed in terms of the mitigations to try to reduce COVID cases have been opposed by those in the Conservative benches. COVID cases will not fall of their own accord. They will only fall through the actions that individually and collectively we take. So if we want to reduce the pressure on our National Health Service, which we all desperately want to do, we need to keep doing all of the things that we know will reduce transmission of the virus.
Christine Graham, to be followed by Jackie Bailey.
Thank you, Presiding Officer. On cross-border vaccination between England and Scotland, the advice is that if you live in Scotland and you've received your first, second or both vaccine doses outside of Scotland, but in the common travel area, which includes England, of course, you should now be able to get your vaccination status via the normal process by an online copy or phoning the COVID helpline. But, First Minister, when my constituents phone the helpline, they are told they need to request proof of that vaccination in England from NHS England. There seems to be confusion here. Can you perhaps clarify?
First Minister.
Well, firstly, I think everybody recognises that it's really important to have consistency for schemes that operate across the UK so that citizens can travel easily between different parts of the UK. The app that we have designed is designed to offer interoperability across not just the UK but the common travel area, and that includes Ireland as well as the Crown dependencies. That said, it's right and proper that we design a scheme that is right for Scotland and works first and foremost in our context and offers us the flexibility to adapt to changing circumstances. Work is well underway to ensure that where a person has their first and second vaccinations either side of the border, this is fully and appropriately recorded, and I'll ask the Health Secretary to put further information on the detail of that into SPICE.
Jackie Bailey, to be followed by Siobhan Brown.
First Minister, I have a number of recent cases of people who have applied for a self-isolation grant, and yet 8 to 11 weeks later, they haven't yet received any support. This is causing enormous pressure on household finances, especially for those on low incomes, and many may be forced to return to work for financial reasons, even though their self-isolation period has not ended. I'm told by Western Berkshire Council that this delay is because the local authority had not received money from the Scottish Government. Can I ask the First Minister if this is true, and what action she will take to ensure that self-isolation payments are now made promptly?
First Minister.
I'm certainly not aware of that being the case, but I will look into that just to make sure it is not, and if there's any issue there, I will undertake to make sure that is resolved. Obviously, not everybody who applies for a self-isolation payment is eligible for a self-isolation payment. If these are eligible, if Jackie Bailey wants to send them to me, I'm happy to look into the circumstances. But on the specific issue of flow of resource, while I'm not aware of that being an issue, I will undertake to investigate it.
Siobhan Brown, to be followed by Russell Finlay.
Last week, I met with Ayr United Football Club chair and directors to listen to their concerns regarding vaccine certificates. Can the First Minister please provide an update on what training and support will be in place for businesses, events and sporting stadiums who need to implement the vaccination certification next month?
First Minister.
Well, the provision of training and support is important. We're currently working with sectors on an ongoing basis, as we've said previously, on all of the different operational issues around certification. We are working right now to provide appropriate guidance, sector-specific guidance, that will allow businesses to provide information and appropriate training to staff. Obviously, that has to be sector-specific because the requirements in, for example, a nightclub with a relatively small number of people will be different to the requirements at a stadium that have many people going through it. But that is the sector-specific guidance that is currently being developed and finalised.
Russell Finlay, to be followed by Audrey Nicholl.
First Minister, it's almost 2 weeks since you first announced the introduction of vaccine passports. We've just heard from the COVID Recovery Secretary that there is still no definition of what a nightclub is, and I'm not talking about the Google definition. With the scheme due to start in less than 3 weeks' time, can you tell businesses when a definition will be given to them and why it is taking so long?
Well, it's taken a bit of time. It's taken a bit of time because we're doing what Conservative members usually ask us to do and say we don't do enough, which is consulting with the businesses in affected sectors to make sure we get the granular detail of this correct. We will finalise the definition very soon. So it's a definition that is going to take account of, for example, whether settings are open between particular hours, whether they are serving alcohol between those hours, whether there is space for dancing and live or recorded music. We're taking the time to make sure we properly consult with the Nighttime Industries Association just to get the detail of that right, and we will publish it soon once that work has concluded.
Audrey Nicholl, to be followed by Gillian Mackay.
Thank you, Presiding Officer.
Throughout the last year, I've been in regular contact with constituents who were vaccine trial participants. Can the First Minister provide an assurance that trial participants will be included in the forthcoming vaccine certification scheme?
First Minister.
This is obviously an important issue for those who did take part in vaccine trials, and again, let me thank anybody who did that. We've been very clear that nobody who took part in a trial will be disadvantaged. The scheme will recognise their vaccination for domestic purposes. All clinical trial participants have already received a letter from their principal investigator, which can be used for proof of their trial status. This provided an interim measure to enable people to gain access to domestic venues where certification is required. Recently, we have also issued participants with a record of vaccination which contains a 1D barcode and security features consistent with all records of vaccination.
Gillian Mackay, to be followed by James Dornan.
Thank you, Presiding Officer. Millions of children around the world have already been vaccinated, and the UK is significantly behind other countries in its rollout to young people. As the First Minister outlined, cases are beginning to fall, but numbers are still far too high, and it's vital that we vaccinate 12 to 15-year-olds as quickly as possible. What action will the Scottish Government take to encourage take-up of the vaccine for this specific age group, and how can we encourage looked-after children, and particularly young carers, to ensure that they get their vaccines?
First Minister.
Well, as I said earlier on, we will move as quickly as possible, but we will also move in a way and at a pace that allows informed consent to be arrived at. I think particularly for this age group that is really important. Yeah, I've expressed frustration in the past that it has taken so long to get to this point, but we are where we are, and now what is important is that we move forward at pace. So what is going to be really important here is the information that is provided, which needs to be accessible for young people themselves, not just their adult parents or carers. It's really important that those who are in drop-in clinics or vaccination clinics are available to address concerns and answer questions. And of course, vaccinators are used to doing this with other vaccination programmes, so they are best placed to do that. And that we strike the right balance between, as I will do unreservedly today, encouraging people in this age group to really engage with this and get vaccinated, but also being understanding about the issues and the questions that younger people will have. And I think if we proceed on that basis, we've got every reason to be confident that we will achieve uptake levels in this age group as good as we have in other age groups as well.
James Dornan, to be followed by Rona Mackay.
Thank you, Presiding Officer. First Minister, we know that long COVID can't be properly handled with a one-size-fits-all approach due to both its complexity and the diversity of its symptoms. Can you advise us what steps the Scottish Government can take to ensure that different health boards have flexibility to deliver the care that local people living with long COVID need?
First Minister.
I think James Dornan is absolutely right that we cannot, and I don't think any country will be able to have a one-size-fits-all approach to dealing with long COVID. We're trying to recognise the need for flexibility in all of the approaches we're taking. As James Dornan will be aware, we recently established a £10 million long COVID support fund. That is additional resource designed to strengthen services across the country for people with long COVID. We're also working with boards and others to identify where this additional resource is most needed and where it will have the biggest impact for those affected. I think key to this is, as James Dornan rightly says, is supporting health boards to deliver tailored responses to meet the differing needs of people with long COVID, and that will allow people to access services that are appropriate to their own health needs, but also appropriate to the part of the country that they're living in. So I very much hope that this fund will lead to a lot of developments in the weeks and months to come that will help those living with this condition.
Rona Mackay, to be followed by Edward Mountain.
Thank you, Presiding Officer. Can the First Minister provide an update on the Scottish Government's latest engagement with the UK Government regarding international travel restrictions?
First Minister.
Well, there's regular official level dialogue on border health measures, and there is indeed due to be a Four Nations ministerial meeting this week addressing the regular review of country risk ratings and looking at some wider policy issues. We expect that meeting will take place on Thursday morning as usual. I know there's a lot of speculation in the media about the UK Government's intentions here. I should say that that speculation is happening before these intentions have been properly discussed with counterparts in the devolved administrations. We do want to work in a Four Nations basis wherever we possibly can, but we will aim to make further announcements on any future changes on a Four Nations basis, hopefully after proper consideration and discussion.
Edward Mountain, to be followed by Fiona Hislop.
Thank you, Presiding Officer. First Minister, the COVID pandemic has shown us just how important our frontline NHS staff are, a point you stressed this afternoon. The pressures they face mean we must protect their well-being and provide them with really high quality leadership. Recent survey, however, suggests that bullying, even during the pandemic, remains a problem within NHS Highland. Last week, your Cabinet Secretary reneged on your government's promise to bring forward a debate on this issue in the Parliament. First Minister, do you support him? And are you happy with him breaking your government's promise?
First Minister.
Well, can I first of all say bullying in the National Health Service is unacceptable, as bullying is unacceptable in any setting. There is no hesitation. I think what the Health Secretary said was that our priority right now is, I think most people would understand, is to deal with all of the various COVID-related issues, not least the extension to the vaccination programme. I am perfectly happy for a debate to be held in this Parliament in government time, if that is the view. I think the Tories have opposition business tomorrow, where it would have been an option for them. It's entirely up to them to debate this in their time, but I'm happy to repeat that commitment that when we are able to, that we will bring forward in government time a debate on this issue.
Fiona Hislop, to be followed by Michael Mara.
Can the First Minister say what discussions the Scottish Government has had with the UK Government about their vaccine procurement contract with Valneva in West Lothian? Valneva is a well-established vaccine production facility, previously visited by both the Prime Minister and the then UK-based Secretary of State on separate visits during the pandemic.
First Minister.
Well, can I thank Fiona Hislop for the question and recognise her constituency interest in this alongside that of Angela Constance, of course. I know she was in the chamber when the Health Secretary answered a question on this a few moments ago. In terms of the UK Government's decision to terminate the contract with Valneva, that was taken by the UK Government unilaterally. As the Health Secretary has indicated, he was informed of that on Saturday by the Secretary of State for Health. We don't have full details of everything that lies behind that decision, although I know the Secretary of State for Health has indicated in the Commons today that it may have been that the vaccine would not have received MHRA approval. But obviously, I would repeat the call from our own Health Secretary that the UK Government should publish all of the relevant information around this in terms of transparency. For the Scottish Government's part, Scottish Enterprise is already in contact with the company. We will do everything we can to support the company in light of this decision, because obviously we want to see that facility not just remain in Livingston, but go from strength to strength in future, and we'll do everything we can to support that. And the last point, I think it is important to reiterate, although the Health Secretary has already made it, this decision, however regrettable it may be, does not affect our ability to extend the vaccination programme in the ways that we have been talking about today.
Michael Mara, to be followed by Emma Harper.
Thank you, Presiding Officer. Figures show that just 5% of senior pupils in Scotland took a COVID test last week, as COVID-related school absences are soaring. With Test and Protect virtually non-existent in schools and no tangible action yet taken on ventilation in classrooms, testing is one of the only tools of defence the Government has made available to keep pupils and staff safe and to minimise further educational disruption. What immediate action can the First Minister take to increase those testing figures?
First Minister.
Well, firstly, it's not the case that lateral flow testing is the only mitigation being applied in schools. The work around carbon dioxide monitors leading to the assessment of ventilation is underway. There is a range of other mitigations in place. And of course, contact tracing has not been ended in schools. It has been done, I think, rightly on a more targeted and proportionate basis, because before the summer holidays, we knew that there were significant numbers of young people having their education disrupted when that wasn't strictly necessary. In terms of how we get more young people to take LFD tests, we make these available free of charge. They are easily accessible, and I think it's incumbent on all of us, both here in the Chamber, within our own constituency networks, and in every possible way to encourage young people to do these tests. I understand that for young people in particular, they're not pleasant, they are inconvenient, but they do provide us with an added layer of protection. So I take the opportunity today to encourage all young people and to encourage parents and carers to take up the opportunity of LFD testing twice a week, and on an additional basis if you get one of these low-risk contact letters.
Emma Harper, to be followed by Jenny Minto.
COVID vaccination certificates will play an important role in reducing risk while maximising our ability to keep open certain settings and events where transmission is a higher risk. So it's important that staff at venues affected are properly supported to implement the scheme. Can the First Minister provide an update as to the work being conducted to prepare detailed guidance on how to use the NHS Scotland COVID Check Verifier app?
First Minister. I think we should remember that 85% of the adult population are now fully vaccinated. That number is increasing on a daily basis. In Scotland, there was an 11% increase in first doses for 18 to 29-year-olds in the 12 days following our announcement of COVID certification compared to the previous 12 days. So again, I think we can see, albeit on an early basis, that it is having an impact in driving up vaccination uptake. So we encourage everyone to get vaccinated. There will be some people who have not completed their full vaccination course when the certification scheme comes into place. People can check their vaccination status, of course, through NHS Inform, and there's details available of how to do that. And the app will go live later this month, which again makes this system even easier. So these are all things that none of us want to have to do. I hope this doesn't have to be in place for very long, but while it can give us an added layer of protection, particularly as we go into the winter months, I think it's important that we do take advantage of it. Jenny Minto, to be followed by Maurice Golden.
Thank you, Presiding Officer. Can the First Minister provide an update as to the Scottish Government's work to respond to the global impacts of COVID-19?
First Minister.
Well, I think that's a really important question, because while we understandably and rightly to some extent focus on the domestic impact and implications of COVID, it is a global pandemic and none of us will be truly safe from it until it is under control, well under control across the whole world. In summary, and I can provide more information for those who are interested, we have provided support to our existing international partners. We undertook a review of our approach to international development at an earlier stage of the pandemic so that we could better target support. We've authorised over £3 million of support from our International Development Fund, targeting COVID-specific initiatives in our partner countries, which are Malawi, Rwanda, Zambia and Pakistan. So that includes £2 million to UNICEF to help prepare health systems to distribute vaccines, £500,000 to support vaccine rollouts, online learning, healthcare, and more recently our donations of vital medical supplies include oxygen concentrators, ventilators and PPE through the NHS Scotland Global Citizenship programme. We also, of course, sent oxygen and ventilation equipment to India. And lastly, our Humanitarian Emergency Fund has supported vulnerable communities in countries such as Syria, Yemen, Somalia, South Sudan and Afghanistan.
Maurice Golden, to be followed by Colin Smith.
Thank you, Presiding Officer. My 31-year-old constituent received a first dose of AstraZeneca before others in her age group because she was in an at-risk group. When it subsequently emerged those in that age group were being offered the Pfizer vaccine, my constituent opted not to receive the second AstraZeneca dose after discussing with her GP. Would it be possible for those in this particular category to be granted a vaccine certificate in order to access certain venues?
First Minister.
I think the advice for somebody in that position is to get the second dose of vaccine, but I obviously don't want to say too much about the individual case because clearly there's been GP input and advice there. I'm very happy to look into that issue in more detail and come back with a considered answer rather than one before having had the opportunity to properly consider it. I think the default position is we would encourage people to complete their second doses, but if there are circumstances in which that cannot, for good reason, be done, then obviously we'd want to take full account of that. So I'll write to or ask the Health Secretary to write to the member once we've had an opportunity to consider it further.
Colin Smith, to be followed by Jamie Halcrow-Johnston.
Thank you, President Officer. I want to come back to the issue around cross-border because the First Minister knows that every day thousands of my constituents travel just a few miles to Cumbria and Northumberland for work, many for the NHS, so naturally they were vaccinated by their employer in England. They can't get a vaccine certificate from NHS England because they're registered with a GP in Scotland. They can't get a vaccine certificate from NHS Scotland because there's no record of their vaccination. I'm dealing with cases already where NHS staff can't get a well-earned break because they can't get vaccine certification. The First Minister Officer says action is taking place at the moment to resolve this. So can she give a categorical assurance that if this is rolled out to events and nightclubs in just 2 weeks' time, none of my constituents will be denied getting a vaccine certificate simply because they were vaccinated in England?
First Minister.
Yes, I do want to give that assurance. Clearly, we are working to resolve the cross-border issues. I think, as anybody would realise, we are not in control of what happens in England, so it's not something we can do unilaterally. That's why the discussions between governments are important here. We hope and expect that there will be a solution in place soon, and we'll make the details of that known. But it's in nobody's interest to disadvantage anybody. We want the whole point of vaccine certification is to allow people to go about their normal lives and not have to see these places close or be unable to access them. This is about enabling activity in the economy, not the reverse.
And Jamie Halcrow-Johnston.
Thank you. We know the detail of the Scottish Government's plans for vaccine passports has been severely lacking. So can I ask the First Minister if all those eligible for vaccination will be required to have a vaccine passport for certain events? And if, as now recommended by the UK CMOs, 12 to 15-year-olds will be offered a single vaccine dose, would that mean a 14-year-old might need to have a vaccine passport just to go and watch their local football club play if the attendance is over 10,000 people?
First Minister.
The requirement for vaccine certification doesn't apply to 12 to 15-year-olds, so that point is not relevant in that regard. I won't repeat all of the points I've made about the ongoing work to develop the finalised detail around the operation of this on a sector-specific basis. But in terms of the detail of the vaccine certification programme in Scotland, it is identical to that published on page 24 of the UK Government's document today, where they set out their continued, they call it Plan B, but the continued plans to introduce vaccine certification should it be required. The only difference is that we are trying to give businesses here certainty. The UK Government appear to have removed that certainty and are just saying maybe they will and maybe they won't. But the level of detail is pretty identical.
Thank you. That concludes the First Minister's statement. Point of order, Stephen Kerr.
Presiding Officer, for the second time in 2 weeks, the First Minister has read the wrong pre-scripted answer to her backbencher's pre-scripted question. Stuart McMillan asked about the inquiry into the Scottish Government's handling of the pandemic. The First Minister's answer was all about schools. So can you, Presiding Officer, please advise as to what options there are to ensure that we hear an answer to the question that was actually asked?
Thank you. I thank Mr Kerr for his point of order. The content of members' contributions is, of course, not a matter for me. There is a mechanism by which members may accurately reflect any change they may wish to make via the official report. As I was saying, that concludes the First Minister's statement, COVID-19 update, and there will be a short suspension before the next item of business.
Can I remind members that social distancing measures are in place in the Chamber and around the Holyrood campus. I ask that members take care to observe these measures, including when entering and exiting the Chamber. Please only use the aisles and walkways to access your seat and when moving around the Chamber. The next item of business is an urgent question, and I invite Gillian Mackay to ask the urgent question.
Thank you, Deputy Presiding Officer. To ask the Scottish Parliamentary Corporate Body for what reason it applied for designated status for the Scottish Parliament under the Serious Organised Crime and Police Act 2005 and whether it will publish the background paper upon which this decision was based.
Claire Baker.
Thank you, Presiding Officer. On behalf of the Scottish Parliament Corporate Body, I welcome the opportunity to correct some of the significant misunderstandings and inaccuracies regarding our decision to seek designated status for the parliamentary estate that have been reported and commented upon. The SPCB takes its responsibility to provide a safe and welcoming parliamentary estate very seriously. As you all know, the Parliament welcomes and facilitates thousands of protests all year round as an essential part of the expression of democracy in Scotland, and I categorically assure Parliament and the public this will not change. Corporate body members considered a paper and received a comprehensive briefing from Police Scotland and had opportunity for full discussion. The decision to seek designated status was unanimous and no member requested that this decision be put to a vote. In applying for designated status, we are not seeking to curb or limit protests. The reasons for applying for designated status is to give the Parliament the means to address protests by individuals where they try to prevent Parliament from meeting to carry out its essential role, who seek to interfere with the rights of others to engage at Holyrood, or where their actions make it unsafe for others. Unfortunately, Parliament has experienced this kind of disruption impacting on its democratic role. In taking the decision to apply for designated status, the SPCB has listened closely to police advice. We have considered the experience of other parliaments, such as Westminster and Wales, where the same measure is available. After very careful consideration, we were assured that this measure offers additional support, which will only be used in a small number of the most exceptional circumstances, which cannot be resolved by the usual means via our on-site security and Police Scotland. In practice, we are assured that the corporate body will be consulted and engaged on any circumstances where the designation will be used, and as the Chamber knows, the corporate body does not publish papers which include security advice.
Thank you, Ms Baker. Gillian Mackay.
Colleagues will recognise a significant concern around the change in status of the Scottish Parliament estate from the 1st of October, which will criminalise some forms of peaceful protest, as we have seen elsewhere, such as reading out the names of dead soldiers. Unfortunately, statements from the SPCB have failed to recognise this. I know many MSPs have joined protests outside this Parliament, as I have, for a whole range of issues. Protest is a fundamental part of our democracy, and the Scottish Parliament should be open, accessible and welcoming of peaceful protest. Can I urge the SPCB to reconsider this decision, which I don't believe can be justified?
Claire Baker.
I will make it very clear that this measure will not criminalise protesters who come to put their case outside Parliament. And I myself have been on marches and demonstrations all my life, and I would not support measures to curtail them. They are a vital part of our democracy, and I fully support people's right to protest at this Parliament. This is about protecting the functions of the Parliament, our ability to conduct business, the health and safety of all who come here, including our Parliament security staff, and being cognisant of the impact on the public purse of the current limited options which are available to us.
Thank you. Further supplementary, Gillian Mackay.
I also have concerns about how this process has been conducted. The minutes of the SPCB's meeting on the 24th of June note that the SPCB discussed the matter and highlight that concerns were raised by Maggie Chapman MSP. The minutes make no mention of consulting MSPs nor the public, and in fact MSPs were not even informed of the change until legislation had already been laid in the Commons. Does the member not accept that the controversy around this matter could have been avoided if the SPCB had adopted a more transparent approach, in line with the Scottish Parliament's key principles of accountability and open participation?
Claire Baker.
Thank you. The member will know that members of the corporate body have a responsibility to make decisions on behalf of Parliament in certain circumstances. This is often where it includes the security of the Parliament and the security advice that we receive from Police Scotland. We had a very thorough debate at the corporate body. There was no member who proposed that we have a vote
We listened very carefully to the arguments that were made. We expressed some of the concerns that have been raised by members, and we were satisfied with the answers that we received that this was the correct course of action to take.
Thank you. Given the public interest in this, I'm going to call a couple of supplementaries. Firstly, Stephen Kerr.
Thank you, Deputy Presiding Officer. First of all, I'd like to thank the member for her clarification on this matter. I was dismayed to see it was actually a member of the Scottish Parliamentary Corporate Body that was guilty of passing on the kind of misinformation that we have seen in the media and elsewhere. So does the member agree with me that as parliamentarians we have a duty and a responsibility to ensure the public is not misled?
Claire Baker.
I am pleased this afternoon to be able to give clarity to some of the reports that happened over the weekend and make it clear this is not about criminalising protests that take place at Parliament. And members should avoid making misleading comments in public. We do all have a responsibility to ensure that information we provide is clear and accurate. And MSPs did all receive an email from the presiding officer on Thursday explaining the decision of the corporate body.
Thank you. And Martin Whitfield.
I'm very grateful to the Deputy Presiding Officer. And again, I echo Mr Kerr's conclusions that it's a good opportunity to clarify the situation that arose over the weekend, and possibly is a situation where a better communication at the start might have avoided this. I know this is challenging because much of the evidence that you receive from the police is confidential, and rightly so, and you make those decisions. But could you possibly give an example of the sort of situation where this would apply, rather than to people who want to gather outside to have their views known to us in here?
Claire Baker.
I thank the member for the question. It is difficult to provide an example that links directly in the chamber this afternoon, but if members reflect on incidences that the Parliament have had to deal with in recent years, where sometimes it has been a protracted solution to situations and it has often been a costly solution, this designation would help, I think, in those situations. Thank you.
Thank you. I'm going to pause proceedings for the front benches to change. We move on to the next item of business. Okay, before the Cabinet Secretary's crutches give rise to any further mishaps in the workplace, the next item of business is a debate on motion 1190 in the name of Humza Yousaf on a caring nation, recovering, remobilising and renewing health and social care in Scotland. Could I invite members who wish to participate in the debate to press the request and speak buttons now, or placing R in the chat function if they are joining us online. And I call on Humza Yousaf to speak to and move the motion for around 11 minutes. Cabinet Secretary.
Thank you, Presiding Officer, and can I apologise to Mr Carlaw for the unfortunate positioning of my crutches. We wouldn't have wanted to add to our waiting list given the significant challenges we all already have. Presiding Officer, I'm really delighted to be opening this debate on behalf of the Government. Of course, I've moved the motion in my name. We are living in extremely challenging times. We're living through a global pandemic which has brought extremely significant challenge for health and care services right across the world. But right now, our NHS and social care systems are under more pressure than they have ever been under at any point in the pandemic. In fact, the NHS is undergoing the biggest shock of its 73-year history. Today, there are over 1,000 COVID patients in our hospital. That number has more than doubled in the last 2 weeks. But to provide wider context, over the last 18 months, our hospitals have dealt with over 31,546 COVID admissions, enough to fill well over half of Hampden Park. And over 2,455 have been admitted into ICU. These numbers are not just staggering in terms of scale, but also, of course, tragic in terms of the human impact they've had on so many. And I know my thoughts and the thoughts of the entire chamber go to every single family and community that has been bereaved by the impact of COVID. At the same time, we've seen our NHS continue to deliver emergency and urgent care, for example cancer, as well as standing up the biggest ever vaccination and testing and contact tracing programmes ever seen, and I suspect we will ever see in this country. Through the first 2 waves of the pandemic, we responded by standing down non-urgent procedures, pausing some important aspects of our health service, such as some screening programmes, and critically, demand for primary care and A&E were significantly reduced as people stayed at home or, sadly, were reluctant to seek advice on their symptoms. This is not over, though, far from it. This third wave has already brought pressures to a new level. COVID numbers are high again. In the last couple of weeks, they have been at record numbers. We are still dealing with urgent and emergency procedures. We are restarting paused services as quickly as possible, while still, of course, running the Test and Protect and indeed vaccination programme. On top of that, we're seeing record levels of presentations to A&E, just as one statistic to demonstrate how that challenge has materialised. Over the last week of August, over 27,000 people presented at A&E. So the last time we saw 1,000 people in hospital with COVID, which was last December, there were just over 19,000 presentations. So we've seen a 40% increase, currently placing even more pressure on our NHS. Acute bed capacity across our health boards is sitting at as high as 98% in some cases, so there just simply isn't the headroom we had at the beginning of the pandemic. Important infection prevention and control measures mean it's taking longer to assess people, to move them, or indeed to move them to discharge or admission. All of this, coupled with increased length of stay in hospital due to people presenting at hospital later and sicker, means our hospitals are fuller than they have ever been, and with a wide range of ailments, not just COVID. By definition, the workforce has been under sustained and unprecedented stress. They are not immune to that, nor are they, of course, immune to COVID. They live in communities like the rest of us. With high prevalence comes staff absence across both health and social care settings. For social care, this means it can take longer to discharge people who are ready to leave hospital, but cannot be accommodated in care settings due to staff pressure already adding to pressure on beds. No one single part of the health and social care system operates on its own. We are all aware of that. They are entirely interconnected and interdependent upon each other. And that is apparent, and that is why we are tackling the challenge we face on all fronts with a comprehensive programme of investment, not just targeted to one part of the health service, but taking a whole systems approach across GP services, NHS 24, the ambulance service, our acute sector, and of course social care too. Of course I will.
Willie Rennie.
Toomey's going to come on to the justification for the centralisation of social care, but this will be the third bureaucratic reorganisation since this Parliament was created. The others haven't what? What makes them think that this time another reorganisation is going to make a difference?
Cabinet Secretary.
I won't go into the past battles around Police Scotland, but I think on that the Liberal Democrats have been thoroughly defeated in terms of the National Care Service. What I would say is actually what we'd like to do is improve and, of course, increase the terms and conditions for social care staff right across the country. And we can do that by ending the postcode lottery of social care, by ensuring that that is accountable to ministers. But we will speak, I'm sure, at length in this chamber on many occasions about the National Care Service. Our colleagues across health and social care... I will.
Stephen Kerr.
For giving way. He was speaking about waiting times and waiting lists. So may I ask him, how many people in Scotland are currently on waiting lists for treatment, and how long does he estimate, or how long has the model estimated it will take to get that backlog under control?
Cabinet Secretary.
I will come on to the detail of waiting lists. It is, as he knows, extremely significant. He also knows, of course, that is a challenge that is being faced by governments right across the UK. But he is right, of course, to ask how long that will take to resolve. There's two things I would say to Stephen Kerr on that matter. First of all, I'm afraid we are still adding to that backlog because we are in the midst of a global pandemic. The pandemic has not ended, so therefore, by very definition, we are still facing these challenges and pressures. But our NHS recovery plan, backed by over £1 billion of investment, sets out in detail how we will recover that challenging that backlog. If you don't mind, since it's Mr Ewing, my goodness, of course I will give way to the esteemed.
Very generous of the Cabinet Secretary, and thanks for giving way. The Cabinet Secretary has given details of the heavy burden on NHS services throughout the country, partly, perhaps largely, as a result of the COVID pandemic. Plainly, with COP26 close on us, we will see arriving in Scotland and focusing in Glasgow several tens of thousands of people and concerns perhaps about importation of new strains of the virus. Can the Cabinet Secretary assure the House that the Scottish Government has given the fullest consideration and carried out a detailed assessment of what possible contingent consequences there may be with regard to the arrival in Scotland of such a large number of people at a time when we are having concerns about mass events?
Cabinet Secretary, I can give you back a bit of that time.
Thank you, Presiding Officer. I can give those assurances to Fergus Ewing. We are working with the UK Government, we're working with the United Nations, we're working with all stakeholders to try to make this event as safe as possible. But I cannot stand here in all honesty and tell them that it will be a risk-free event. We'll do our best to mitigate that risk as best we possibly can. If I can continue, Presiding Officer, I just want to give some detail of some of the funding that we've provided right now in year. We are not simply waiting for this pandemic to be over to take actions to help our care and health service. Additional funding of £30 million has been given to the Scottish Ambulance Service and NHS 24, £12 million to support acute care. That will help in opening additional bed capacity, £23 million for the redesign of urgent care. That reduces demand at A&E, providing more support within the community, £155 million for primary care, including restoring face-to-face treatment and additional support for NHS 24 and the Scottish Ambulance Service, and £120 million for mental health services, which will focus on prevention and early intervention, as well as, of course, helping to clear the challenging CAMS backlogs. Some of the immediate actions we've taken to support social care pressures include funding support to advertise vacant posts on a dedicated social care webpage, targeted communication with further and higher education, healthcare, nursing students and social work students to encourage applications to join the workforce. And of course that is in addition to us providing funding to ensure that social care staff are paid at least the real living wage. We will do all we can to support and reward those who work in health and social care. We've already implemented a 4% pay increase for Agenda for Change staff. That's the biggest single year rise in the lifetime of this Parliament. Our recovery plan, of course, sets out, as I said in response to Mr Kerr, how we will deal with the significant challenges that we are facing. That backlog, of course, is significant. I know there was challenges with that pre-pandemic, but I think it would be absolutely fair to say that those have been significantly exacerbated by the shock of that pandemic. Our plan, backed by a billion... Yes, I haven't given way to a Labour member. I'm happy to do so.
Paul Sweeney.
I thank the Cabinet Secretary for giving way. He notes, of course, the significant pressures under the health service is facing under the current situation. However, he may have noticed today the particular case of Brian Snedden in today's Daily Record in relation to ambulance services. Brian suffered a stroke last week, but was left in his house for over 2 hours, and eventually his son and his son's cousin had to drive him to the hospital. And because he didn't get treatment within 4 hours after suffering a stroke, he now faces a much more complex journey to rehabilitation. That then introduces further long-term costs and pressures on the NHS. Can I urge the Cabinet Secretary to look specifically at ambulance responses to urgent cases around stroke victims and where that can be avoided? Because I don't think there's much that the Cabinet Secretary can say to assuage the suffering of Brian and his family as a result of the complexities he now faces. But this is particularly problematic, and we really need to get on top of it quickly.
Cabinet Secretary.
Check, Presiding Officer, how much time I have, so I can tailor my speech.
I can reimburse you 12 and a half minutes. We're quite tight for time, so
I was going to say you were generous, Presiding Officer. In response to the very serious story and case that Mr Sweeney raises, I did see the details of it. Can I, first of all, give my sympathy to Mr Snedden, but it's not my sympathy, he is right, that they need is action. And I've just detailed some of the work that we're doing to fund and invest in the Scottish Ambulance Service. What I can't do, and I know Mr Sweeney understands this, I can't wave a magic wand to make the effects of the pandemic which we are currently living through disappear. But what I can promise him is that I'm speaking to the Scottish Ambulance Service with great regularity to see what more we can do, not just to invest in the ambulance service, but just as I've said, if we can improve the flow into A&E, that can also help ambulances to be discharged, to get to people sooner and quicker. But I thank Mr Sweeney for raising the important case of Mr Snedden. Our recovery plan, of course, gives great detail of how we intend to work through the challenges to remobilise, to renew and to recover our NHS. We will increase inpatient capacity by 20%, outpatient capacity by 10%. We will recruit an additional 1,500 staff to work in our network of national treatment centres right up and down the country. I will leave it to my colleague Kevin Stewart to give more detail of the National Care Service, which I know is of great interest. But what I wanted to end my speech by saying is that we all know just how challenging the last 18 months have been for everybody. But I think we would all agree that our staff in our National Health Service and social care have been heroic in their efforts. And that's why a common thread throughout the NHS recovery plan is ensuring that we invest in the well-being of our NHS and social care staff. So we have committed an £8 million package of support, and that's also included within that is £2 million of support targeted at social care and primary care. We will continue to work closely with the NHS, with trade unions and others to see what additional support we can offer. And I will conclude, Presiding Officer, by saying that I think all of us will be agreed that the NHS and social care staff have made a heroic effort over the last 18 months to do so every day, but particularly over the last 18 months. And I want to end by thanking them all and by giving them an absolute guarantee and a promise that this Scottish Government, and I suspect all of the Chamber, will ensure that they are recognised and supported for what will still be a challenging period ahead. And I'm happy to move the motion in my name.
Thank you, Cabinet Secretary. We are quite tight for time this afternoon. I do want to encourage members to make and take interventions, but I would encourage them to make them briefly, and I will try to reimburse members for that time. I now call on Craig Hoy to speak to and move Amendment 1190.3. Mr Hoy, around 7 minutes, please.
Thank you, Deputy Presiding Officer. COVID-19 has been linked to nearly 11,000 Scottish deaths. 1 in 3 of these has tragically taken place in our care homes, and our thoughts go out to their families and also to the families of all of those who have died during the pandemic. Deputy Presiding Officer, the cost of cancelled operations, delayed diagnosis and the failure of many patients to be able to access healthcare will be significant. But ministers must also accept that many of these problems predate the pandemic. Deputy Presiding Officer, before I turn to proposals for the creation of a National Care Service, a brief review of the challenges facing our National Health Service will prove sobering. In our A&E units, over a quarter of patients are still not seen within 4 hours. 115,000 patients are waiting to be seen for key diagnostic tests. The 12-week treatment time guarantee is at its 3rd lowest level of performance since records began. A fifth of patients are waiting too long for mental health treatment. Drug deaths have... I'd like to make some progress first, thank you. Drug deaths have tripled under the SNP government, and waiting times for residential rehab regularly exceed a year. BMA Scotland Chairman Dr Lewis Morrison says doctors are exhausted. Many are simply considering leaving the NHS altogether. The Royal College of Emergency Medicine says there is genuine concern that hospitals will not be able to cope this winter. Deputy Presiding Officer, COVID has contributed to these challenges, but COVID is not ultimately the root cause. Years of this government's poor workforce planning are finally taking their toll on our NHS. The First Minister told Parliament last week that the creation of a National Care Service is, and I quote, the most significant public service reform since the creation of the National Health Service. So the builder who botched your extension is now asking if they can build you a new house, all while a public health typhoon is blowing. According to the Philly Review, the creation of a National Care Service will put adult social care on an equal footing with our NHS. But a brief look at our NHS in this present crisis raises serious questions about whether this is the right time to embark on such significant reform of adult social care. The Scottish Conservatives readily concede that social care in Scotland needs reform and investment, and we will look closely at the government's final proposals. But the question is how far this process should go and how fast. Hard-working staff are exhausted. The system is under immense strain. There are long-term demographic, structural, staffing, commissioning, funding and delivery challenges. Last year, 197 warnings were issued by the Care Inspectorate over staff shortages in care homes. In Fife, 395 people are waiting an average of 77 days for care at home packages. And rather than looking to fix the urgent failings in the system, ministers now propose to bite off far more than they can chew with a widespread reform programme. Despite the current crisis in care, the Scottish Government now proposes to consolidate adult social care, social work, children's services, justice social work, alcohol and drug services and areas of mental health in one service under direct ministerial control. These reforms focus on structures for tomorrow and ignore the crisis in social care today. So while I welcome Kevin Stewart's commitment to further consultation, I wonder if he really is genuinely listening. For if he is, he must already hear the alarm bells ringing on the scope of the proposed service. Will Mr Hoy give way? I will give way.
Minister. Thank Mr Hoy for giving way, and I would challenge Mr Hoy and other members to go and talk to folk with lived experience. COVID has shone a light on social care. Folks are not happy with the current situation. They want to see change. Please talk to the stakeholders and not just those that are normally listened to in this place.
Craig Hoy.
I very much welcome that, but very much recognise that families and those with lived experiences have raised legitimate concerns about social care, but I don't think they've asked for a major structural review in order to fix it. COSLA President, Deputy Presiding Officer Alison Evanson, rightly asks why local government services were, at the very last minute, wrapped into plans for the National Care Service. She says if there is nothing to hide, it should be a fairly straightforward question to answer. And unless I missed it, where was the consultation on the decision to significantly expand the scope of the Feely recommendations? And despite repeated disasters in government IT procurement... No, I need to make some progress. And despite repeated disasters in government IT procurement, this plan glibly proposes a wholesale data sharing system across all care settings, including an interface with NHS medical records. This is despite the fact that the two commonly used GP record systems, EMIS and Vision, don't presently speak to one another. Almost all large-scale SNP-commissioned public sector data systems have hit serious cost overruns, yet the Minister appears confident that this huge IT project can be achieved in this Parliament. Ministers must do more to explain why a centralised service under direct ministerial control will lead to any better outcomes. The lessons from Police Scotland tell us that centralisation undermines local delivery and leads to poor and sometimes tragic consequences, as we saw, sadly, only last week. These plans amount to an attack on local authorities and local accountability. By proposing to scrap health and social care partnerships and integrated joint boards, ministers are finally admitting that their previous attempts to deliver greater integration have failed. So why is the SNP so confident that making Scottish ministers accountable for social care, while driving local delivery through new community health and social care boards, will lead to any meaningful positive impact on social care outcomes? In fact, centralisation ignores the clear need for services to be designed and delivered as close as is possible to the people who use them. Centralising children's services runs the risk of placing vulnerable children far away from the local agencies and the local communities who understand their past problems and their present needs. So how can this possibly lead to better outcomes? And on staffing, pay and the absence of structured career development and social care, will moving to a system of national pay bargaining really tackle the recruitment, retention and career development crisis in our care system. The Royal College of Nursing says the reform process overlooks the nursing contribution in social care. And what of future capital investment? Fears are growing that centralisation will lead to creeping nationalisation, undermining future investment by the private sector. Deputy Presiding Officer, the proposals for National Care Service go way beyond the plans set out in the Feely Review. This is yet another blatant and unjustified power grab by the Scottish Government. And after years of hollowing out Council's finances, the SNP is now mounting a direct assault on local authorities. It proposes to scrap local accountability by imposing a system of direct ministerial control. And so far, the Scottish Government has failed to outline exactly how much these vast reforms will cost. In conclusion, Deputy Presiding Officer, we have very real concerns about the present operation of the NHS. and the future operation of any national care service. These reforms are all about structure, not about improving patient care, and they fail to address today's growing crisis in Scotland's social care sector. Deputy Presiding Officer, that is why I move the amendment in my name.
Thank you, Mr Hoy. I now call on Jackie Bailey to speak to and move Amendment 1190.2. Ms Bailey, you have around 6 minutes, please.
Thank you very much, Presiding Officer. It is absolutely right that we should express our deepest gratitude to those working in health and social care for all that they have done, not just during the pandemic, but equally before the pandemic too. They risked their lives to keep us safe. But I don't just want to thank them, because if the applause on a Thursday night is to mean anything, then the government need to step up to the plate now and truly appreciate and support what they do. Instead of the complacency displayed by the Cabinet Secretary and the First Minister, the people of Scotland need and deserve action. And they need it now, because make no mistake, the NHS is in crisis now. The NHS Recovery Plan has been criticised by a number of professional bodies, including the BMA, who described it as unrealistic, with a number of worrying gaps, especially on how to tackle staff shortages. It is one thing to be criticised by the opposition, but it is another entirely to be criticised by clinicians, and that demonstrates to me that the government is simply not listening. The problems experienced by the NHS are happening now in real time. But let's be honest, this is built on 14 years of the SNP's mismanagement and neglect of our NHS. It was frankly astonishing to hear that the First Minister blamed staffing shortages on Brexit when she was the one, as Health Minister, who cut training places for nurses and doctors. And let's also not forget that it was Nicola Sturgeon who failed to pass on all of the funding to the health service given to her by the UK government in her first 2 years as Health Minister, which means that the NHS now is £1 billion worse off as a result of that under the SNP. The lack of awareness, Presiding Officer, of the SNP is simply extraordinary. So, given that track record, I'll want to make some progress. Given that track record, how can the SNP government expect us to take them seriously? There is a crisis unfolding under their watch. Ambulance waiting times are on average 6 hours for urgent and critical cases. Some have waited as much as 30 hours and their condition has deteriorated to such an extent that it becomes life-threatening. The Red Cross, for goodness sake, are having to provide support and assistance to ambulance crews and patients waiting in queues outside the Queen Elizabeth University Hospital. Waiting times for diagnostics up. Waiting times for treatment up. There are currently 600,000 people on waiting lists in Scotland. Those that can afford to do so are going private. The 62-day waiting standard for cancer treatment going the wrong way. In fact, it's not been met since 2012. That is shameful. Some of the biggest health boards have cancelled elective surgery. COVID infection rates are rising. Over 1,000 hospitalisations, and Test and Protect is failing to contact people, with performance now well below World Health Organization standards. And of course, delayed discharge is up by almost 50%. And the workforce are struggling. A paramedic described how ambulance workers are feeling exhausted, undervalued and overwhelmed. Doctors and nurses go home from a shift at A&E crying because of the stress that they are under. And all of this is before the winter flu season starts. So the NHS recovery plan doesn't address any of those immediate challenges. It talks about a rise in activity starting in 2022. Outpatient rises promised during the election for next year won't happen until 2025. And as for workforce planning, there have been 3 plans published in the last Parliament, and they have simply failed to address the shortage of staff. Now, Scottish Labour set out very clear plans for what we would do differently to remobilise our NHS and support the staff who work so hard on our behalf, and I commend them to the Cabinet Secretary to read. Let me turn to social care, which will be covered substantially by my colleague Paul O'Kane. The government's approach to this is frankly hugely disappointing. Instead of changing culture, as the Feely Review recommended, the focus has all been about structural change. It looks like a case of rebadging and shifting the deck chairs, where what is actually required is to move away from funding crisis to funding prevention, away from limiting care based on budgets to actually doing an honest needs assessment and building care on that basis, so people can live independently. And as for the £800 million promised over the next 5 years, Feely identified the gap as being about £660 million. So little growth available, little headroom is happening. And the government, frankly, doesn't need to wait for the establishment of the National Care Service. They can do things now. Where is the remobilisation plan for social care? Restoring people's care packages, restarting respite care, ending non-residential care charges and pausing commissioning. All of these things the government could do now. And you know, when we talk about valuing staff, this applies equally to social care. Social care staff were at the front line of the pandemic. The epicentre of COVID cases was in our care homes. A third of COVID deaths have occurred in our care homes. They had to fight for testing. They had to fight for access to PPE. Now, the Cabinet Secretary knows this is a predominantly feminised workforce which is characterised by low pay. I know the SNP is opposed to giving them a wage rise to £15 per hour, indeed aligning themselves with the Tories. The Greens promised this in their manifesto, but that's been sacrificed at the altar of expediency in exchange for ministerial positions. Do you know, Presiding Officer, we have a real opportunity to change care, to value the workforce, to treat people with dignity, and to create a system which enables people to live independently. The government's plans are wanting in this regard, and frankly the voices of those of carers and those cared for are not being heard, and that is a disgrace. I move the amendment in my name.
Thank you, Ms Bailey, and I call on Alex Cole-Hamilton to speak to move amendment 1190.4. Mr Cole-Hamilton, 4 minutes, please.
Thank you very much, Deputy Presiding Officer. May I start by echoing the thanks that have been offered to our valiant health and social care workers. We will never fully be able to repay the debt that we all owe them. Presiding Officer, American clinician Atul Gawande once wrote that the battle of being mortal is the battle to maintain the integrity of one's life, to avoid becoming so diminished or dissipated or subjugated that who you are becomes disconnected from who you were or who you want to be. The provision and effective delivery of social care is a vital part of how we answer that challenge, of how we offer dignity, agency and independence to our most vulnerable residents. It's a critical piece of the jigsaw for all other aspects of care and treatment in our society. Put simply, if social care is broken, then it causes an interruption in flow throughout the whole of our health service. Presiding Officer, we know that the record-breaking A&E waiting times are not caused by a deficiency in emergency care, but they are instead the result of insufficient social care provision in our communities. People are waiting in A&E departments before admission to the main hospital because inpatient beds are taken up by those well enough to leave hospital, but lacking the necessary care provision to receive them home. We need to reform social care. Of that, there is no doubt. But we need to reform it through paying care workers handsomely, dealing with market inconsistency, reforming self-directed support, and making care a profession of choice once again. You don't reform it by stripping decision-making power and money away from the local care partnerships that are currently delivering it. And the last thing we need is a big, clunking, centralised bureaucracy ultimately run by Scottish ministers, those same ministers who are in part responsible for the catastrophe in our care homes in the foothills of this pandemic. It is cynical for this government to brand their proposals a national care service, because it is in fact a ministerial takeover of social care. That branding exercise is deliberately designed to make it sound like our most treasured national institution, the National Health Service, but that is where the similarity ends. Presiding Officer, the NHS was forged in the rubble and the poverty of war. For the first time, it offered medical care and treatment to every citizen in the United Kingdom, free at the point of delivery. It is the most successful model of socialised medicine in the world. But the proposal behind a national care service, however, will not see it offered free at the point of delivery. It will not be a socialised model for the delivery of care, nor will we see care nationalised, because it will still be provided by the private and charitable organisations who account for the lion's share of the market. The naming of this project is a cynical attempt to win public support when, in all actuality, the delivery of that care will suffer. This new model simply transfers power from local authorities and local communities and gives it to ministers to determine what the shape of the care service looks like. Presiding officer, Liberals stood against the centralisation of Police Scotland, and we shall stand... I will.
I think that
Kevin
Mr.
Stewart, if you could
Cole...
wait to be called.
Sorry, I beg your pardon,
Mr. Stewart.
Presiding officer. Mr. Cole-Hamilton has said that the government will set the frameworks, and that is right. What we want to see is standardised, high levels of care throughout the country, rather than the postcode lottery that folks moan about just now. How would Mr. Cole-Hamilton suggest we tackle the postcode lotteries?
Mr. Cole-Hamilton.
Your meddling in the centralisation projects that have gone before has not helped people at the business end of the delivery of service, nor will it help in the delivery of care. Presiding officer, Liberals did stand against the centralisation of Police Scotland, and we shall stand against the centralisation of our care system, because for our party, as a matter of principle, that decisions are better made when they are made closer to the people that they most affect. For all that they wish to be remembered with the same reverence as Nye Bevan, the father of the NHS, this government's National Care Service is a cynical power grab and nothing more, and I move the amendment in my name.
Thank you very much, Mr. Cole-Hamilton. We now move to the open debate. As a result of a number of fairly lengthy interventions, whatever headroom we had in terms of additional time has now been exhausted, so any interventions will have to be accommodated in your allotted time. I call first Alistair Allen, who will be followed by Sue Webber. Dr Allen, 4 minutes, please.
Presiding officer, to say that our health and care services have been through an unprecedented shock in the last year and a half would of course be a triumph of understatement. All of us are aware of the impact which the pandemic has had on these services in our own communities, and as the Cabinet Secretary has mentioned, the health and care workforce has been instrumental in delivering an amazing vaccination programme since December of last year, despite the numerous challenges they've had to overcome in the process.
Dr Allen, could you just move your microphone slightly towards you?
Is that better? Very good. Families have often faced distressingly minimal contact with loved ones in hospital and care settings, and staff have had to deal with the physical and emotional exhaustion of a year and a half from hell. And all that is before we consider the huge stresses on them of actually trying to help treat individual people with COVID. Now, I mention all that, Presiding Officer, not as a platitude to everyone concerned, nor as a means of deflecting from the challenges ahead. This winter will bring with it some daunting challenges, not least of which will be dealing with the backlog, as others have pointed out, of non-COVID procedures that clearly now exists. The plans which the Scottish Government are setting out today are genuinely ambitious, not least the £1 billion NHS recovery plan, the development of a national care service and the recognition of the needs of our care workers. The policy of ensuring that at least 10% of frontline health spending will be dedicated to mental health is a major step forward in its own right, and the plans focus on providing alternative pathways of care to allow people to be treated more quickly closer to home will, I am sure, be welcomed. When fully operational, the National Treatment Centres will provide capacity for over 40,000 additional surgeries and procedures across 12 specialities, including cataracts, hip and knee surgery, and this will mean recruiting an additional 1,500 staff to run these centres. Presiding Officer, standing still is not an option for our health and care services. The way ahead does demand that we make changes, and there are many to be made. Given my island constituency, I make no apology for asking today that these changes are island-proofed. People in the islands who have a family member... I look forward to doing so.
Stephen Kerr.
Grateful to the member for giving way. He's making a very good point about island-proofing. Does the member agree that COSLA's comments, that this consultation cuts through the heart of governance in Scotland, and will have serious implications for local government? Does he agree with COSLA's comments?
Dr Allen.
Well, before I come to the island issue, I will merely say that people across this chamber understandably regularly raise what's referred to as a postcode lottery in terms of services, and if we're going to address that, we are going to have to think about what that implies for how we provide the same high standard of care across the country. And as I say, that is going to mean change. The point I'm making about the islands is that people who have a family member in hospital on the mainland, people from the islands, face very significant extra stresses and costs just to visit people, or even just to find out what is happening to them. Stresses and costs which are multiplied if there is not good communication between different parts of the NHS, as well as with patients, airlines and families. Sometimes, I am afraid to say, hospitals have not always quite appreciated, for instance, what discharging a frail person in Glasgow and then asking them to find their way home to the Outer Hebrides actually implies. So I think we need a stronger protocol in place about those issues. And healthcare cannot be seen in isolation from wider economic issues in the islands. If we are going to have more care workers in rural areas, for instance, we will need to do some serious planning about where it is that they are going to live.
You do need to wind up now.
All that pointed out, Presiding Officer, I believe today is an opportunity for the Chamber to unite if such a prospect is not altogether far-fetched, and recognise both the needs of our health and care services and the way we can make them fit for the future.
Thank you, Dr Allen. I call Sue Webber to be followed by Claire Adamson. Sue Webber, 4 minutes, please.
4 minutes tight. Thank you, Deputy Presiding Officer. Scotland's A&E is in crisis. Waiting times have spiralled out of control and referral times are equally as bad. Our workforce in the NHS is at breaking point. A fifth of patients are waiting too long for mental health treatment, and over a quarter of all vulnerable children are waiting too long for their mental health treatment. The creation of a national care service would be a massive undertaking, there is no doubt. So have the SNP reached a new low in terms of self-awareness? I'm sure I'm not alone in wondering why the Scottish Government think they can run a national care service with all the issues they face running the long-established NHS. The drug death rate has almost tripled on the SNP's watch. Deaths caused by alcohol are at their highest level since 2008. Waiting times for residential rehab can be up to a year. Frank's Law has not yet been fully implemented. Yet, the SNP want more powers and responsibilities when they are incapable of using those they already have. And we know under the SNP government that Scotland is facing an A&E crisis, and the NHS waiting lists are faring no better. We've heard that before the pandemic, 450,000 were on the waiting lists, and now that list is topping 600,000. This crisis is an indicator that the entire system is fractured. Behind every statistic is a person or a family desperate for help, often in chronic, debilitating pain. They have all been failed by the SNP, who have shown no leadership or detailed plan of action. They have neglected the NHS, and they have neglected the people of Scotland for years. The SNP should stop trying to rewrite history when the facts clearly tell a different story. The pandemic did not cause this crisis. The SNP did. Bed capacity has routinely been operating at 95% before the pandemic. And you spoke of admissions, but not of discharges. The public have demonstrated immense gratitude to all of those working in the NHS throughout the pandemic and before. COVID has made NHS staff work harder and faster than ever before. And I know this firsthand because I've stood and worked alongside them for years, I'm not telling how many years, frankly, because my age away. And other amendments today focus on the workforce challenges that are faced. 1 in 17 people work in the NHS already in Scotland, and there is also now a long-standing recruitment crisis. Across Scotland, a record 4,854 nursing and midwifery posts are vacant. A significant number of nursing staff are on work-related sick leave through stress and other mental health issues. So where are you going to find these 1,500 new staff for these treatment centres? How long does it take us to train them? In 2017, SNP ministers pledged to recruit 800 GPs by 2027. However, with just over 200 added to the overall national headcount right now, this looks like it is also likely to be missed. Mr Hoy spoke of the 197 warnings that were issued to the Care Inspectorate over staff shortages in care homes. Staffing levels are now reaching crisis point across Scotland in all healthcare sectors. There is no overnight solution to this workforce crisis. The SNP's NHS recovery plan is a flimsy pamphlet that recycles old promises and fails to tackle the long-standing issues. I have literally 12 seconds. It is full of gaps. The Scottish Conservatives believe that healthcare professionals should be given the support they need to end the backlog in treatments in hospitals, restore A&E waiting times, speed up our ambulance service and return to full-face GP surgeries. Scotland's NHS needs a real plan to get our health service back on track. Thank you.
Thank you. I now call Claire Adamson to be followed by Carol Mochan. Claire Adamson, up to 4 minutes, please.
Sorry, Presiding Officer. COVID has changed all our lives, and as my colleague Kevin Stewart pointed out earlier, it has shone a light on the challenges of those who depend on social care and health services as never before. Impacts on carers, those in isolation, on shielding lists, those with disabilities, and those who are lonely in our communities. But it has also shown the civic spirit in which our communities rose to the challenges of COVID. And we must learn the lessons of this. It's not about getting back to normal, it's about getting back to better. Building a better solutions in our communities, a patient-centred service that has well-being of those working and fair work at its heart. In 2009, I was a councillor, and one of the things that deeply disturbed me at that time was that a Scottish Council commissioned services by a reverse auction. A race to the bottom on cost, not about the quality of service, not about an existing quality workforce, and not about the well-being of those who would have to deliver those services. But fair work at the heart of this will mean that the well-being of those workers will be better, they'll be paid at least the living wage, and it's crucial that in delivering the services, it's going to build a care service that delivers dignity and respect to our neighbours, their families and friends, and those in our communities who depend on these vital services. It will be no surprise to those that have been here for a while that for a number of years I have championed the cause of pancreatic cancer. And part of the work that I've done over the years has been asked, the community there have asked for a sea change in the way we tackle, the way we look at pancreatic cancer. It's an unforgiving illness like no other. It is one of the poorest survival rates of any cancer. Late diagnosis frequently being something that happens, and with what are days and weeks for pancreatic cancer can be months and years for survivors and other cancers. One of the things they asked for was that they have a pathway to diagnosis that met the needs of those who were coming into contact with this terrible disease. And the Cancer Recovery Plan announced in December is investing £114.5 million to tackle and help those like those with pancreatic cancer. And the early patient support that will be given and the one-stop shop of diagnosis and treatment will change the lives immeasurably for people who are coming into contact with this. And not only that, the SHPBN networks in Scotland now have a patient support network. This was all championed by Jane Freeman and has all been happening while COVID has been going on. And it's a testament to the immense pressure that our health service people have been under, that they've been able to make such progress in this area alone. This is what we have to be moving forward with. An independent review of social care gives us a clear roadmap for recommendations for a future care provision in Scotland that we can all rightly be proud of, we can all rightly take part in, we can all rightly ensure meets the needs of our friends, our neighbours and our communities going forward, and that we build dignity for those in receipt of the services, but also for those who are working in our services. Thank you, Presiding Officer.
Thank you. I now call Cara Mochan to be followed by Paul McLennan. Up to 4 minutes, please.
Thank you, Deputy Presiding Officer. I share the thoughts of the Cabinet Secretary and previous speakers in wishing to mark the heroic efforts of our incredible NHS and social care workers during the COVID-19 pandemic, and I recognise the work that they will no doubt have to continue doing for quite some time to come. But let me be plain. Surely the best way to recognise that heroism is to give staff the pay increase they deserve. A round of applause is nice, but a pay rise will keep a roof above your head and food on the table. It is, of course, welcome news that further staff capacity will be added to the health service, which is struggling from years of poor management and underfunding. But if we are to retain staff and make them feel valued, then the best way to do that is through good, well-paid jobs. The BMA Scotland have correctly described the proposed 3% pay increase for medical and dental staff as doing virtually nothing to help low morale or end serious difficulties with staff retention, and the slightly larger increase for staff on Agenda for Change grades has been contentious to say the least. It is clear that the annual difficulties in getting a fair settlement for NHS staff is rooted in the fact the work of those in the community, in hospitals and emergency response is not valued as highly as it should be. In one area in particular, the problem is becoming particularly acute. I could go on for a long time about the problems regarding mental health services in Scotland, but I have only 4 minutes. We in this chamber are all more than aware of the need to improve mental health services. But a key starting point for any forward plan has to be recognition of what has gone wrong. And I am not seeing that here from this government. In fairness, they say things, but you never do anything, which says to me you do not recognise the scale of the problem. So, as a reminder, the number of children and young people waiting a year or more for mental health appointments is at record levels, an increase of 115% over the last year. The Government's target to see 90% of referrals within 18 weeks has never been met, not once. Almost 1 in 4 referrals to CAMHS are rejected, with little data regarding what then happens to those who are not accepted. Undoubtedly, successive lockdowns, though necessary, have taken a considerable toll on services and the mental health of many. But we should not pretend COVID is the cause of these startling failures. It all stems from policy decisions and where priorities lie. The fact is, mental health has never been given the prevalence it warrants by this government, and until that changes, the spiralling decline in the mental health of thousands across Scotland will continue. To start making progress, we need dedicated. Yes.
Emma Harper.
Thanks. It's a very quick one. Does Cara Mochan not agree that this Parliament, this government, is the first government that had a mental health minister in the whole of the 4 nations of the UK?
Cara Mochan.
Thank you. I think that we would hope then that we would be making more progress and making less reports, and that we would actually be changing services for the better of people. To start making progress, we need dedicated mental health workers in every GP practice, not just access to one, and significant increase in mental health spending across the NHS without detriment to other services that are equally under strain. We need the resources. There are not simply possibilities at this point, they are absolute necessities. If we are to get the country back on its feet, yes, we will be asking people to work hard and rebuild Scotland, but we have to do our bit. We have to work hard for them.
Ms Mochan, could you bring your remarks to a close, please?
Yep. That means giving people the sort of world-class treatment Scotland was once famed for. The Cabinet Secretary can play a leading role in this, but the Government needs to take action. Thank you.
Thank you. I next call Paul McLennan, to be followed by Sandesh Gohani. Ms McLennan, up to 4 minutes, please.
Thank you, Deputy Presiding Officer. The first line in the Scottish Government's Health Recovery Plan reads, Scotland's National Health Service is our most precious institution, and that we can all agree on. In our hour of greatest need during the pandemic, the women and men who staff our NHS provide exemplary care in the most trying of circumstances. The aim of the plan, of course, is to drive the recovery of our NHS, not just to its pre-pandemic level, but beyond. This recovery plan is backed with over £1 billion of targeted investment over the next 5 years to increase NHS capacity, deliver reforms in the delivery of care, and get everyone the treatment they need as quickly as possible. We've only got 4 minutes, and I want to focus on a couple of key points, both in health and in social care. I think the plan sets out key actions for the next 5 years to help address backlogs in healthcare and increase capacity by at least 10%. Other key actions for me include investment in national treatment centres of more than £400 million, contributing to delivery of over 40,000 additional elective surgeries and procedures per year. I know that will be welcome at East Lothian Community Hospital by my constituents. Raising primary care investment by 25%, supporting GPs, community pharmacists, dentists and optometrists. What's really vital as well is work to support workforce capacity and planning. A national workforce planning strategy which supports remobilisation, recovery and renewal of health and social care services. We're tight for time, sorry. It will be published. This strategy will be published by the end of the year, articulating a long-term health and social care workforce vision, alongside our priorities for workforce growth, recruitment, retention, training and development. And I know the Health Cabinet Secretary is dedicated to that, and I think it's a really important piece of work as we go ahead. The strategy builds on ongoing work to support the Board's workforce capacity. Moving on to care. A National Care Service will be one of the biggest ever achievements of this Parliament. Yeah, sorry. Maybe later on. I'm tight for time. I'm tight for time, Mr. Hoy. I'm tight for time.
The member has said he's not taking the intervention.
No, I'm sure he didn't. I'm sure he didn't. A National Care Service, I said, will be one of the biggest ever achievements of this Parliament. The social care sector directly employs 205,000 people in Scotland, approximately 8% of the country's workforce. The sector is estimated to contribute between £3.4 and £3 billion to the Scotland's economy. So it's a really, really important part of our economy. I, like everyone else, received Oxfam Scotland's briefing for this debate, and it's entitled Placing Care at the Heart of the COVID-19 Recovery. And I think that's something we've got to remember. Care issues and poverty also is an issue that the Oxfam mentioned, that they're deeply linked. Those caring for adults on an unpaid basis report escalating care needs and financial pressures, with polling conducted during the pandemic showing nearly 30% reported struggling to make ends meet. They also say Scotland must commit to a new national outcome on valuing and investing in all forms of care. When we had the local government committee, we had the Cabinet Secretary, Shona Robertson, and also Unison, the local authorities, COSLA. They also mentioned that was really important, was the outcome. So a proposed new national outcome on valuing and investing for care is vital as we move ahead. Outcome and value and investing in care to be embedded within the National Performance Framework to drive policy and spending decisions. And just coming back to the unpaid carers for disabled and elderly care, unpaid carers provide support and care for family members with additional support needs without pay. Prior to the pandemic, there were an estimated 788,000 carers, including 44,000 young carers in Scotland. I know a National Care Service will take into consideration most of the care done in Scotland is unpaid. While ensuring those paid to care are protected from poverty, it must deliver for the people doing unpaid care and those supported by the carers. In conclusion, Deputy Presiding Officer, the actions this Government is taking will place us in a better place as we recover from COVID. Thank you.
Thank you. I now call Sandesh Gohani to be followed by Gillian Mackay. Up to 4 minutes, please, Dr Gohani.
2021 has exacerbated an already crumbling Scottish health service and shone a light onto how bad we have it. A&E waiting times at record level. One patient forced to wait on the floor in a corridor for almost 18 hours. Ambulances queuing around the block to get into hospitals, forcing patients at home to wait extraordinary amounts of time. Waiting lists for outpatient appointments at all-time highs. Non-emergency surgery cancelled across Glasgow. GP demand at record levels. Oh, and wait, we're the Europe capital of COVID. All we hear is deflection and blame and whataboutery. This is down to the SNP Scottish Government, who have had devolved control of our Scottish NHS since 2007. The Scottish NHS, the Scottish patients, the Scottish people need action now. We need help now. The £1 billion recovery plan It's full of rhetoric and catchy sound bites. X millions here and Y millions... I'm afraid I won't get the time back. It's full of catchy sound bites. X millions here and Y millions there. But there is no detail and there is no plan. Let's take recruiting. The Association of Anaesthetics tells me there are 2,000 job vacancies. The Royal College of Nurses says there are 3,000 job vacancies. The Scottish Government will be recruiting 1,500 staff. We're still in deficit. It's not even going to make a dent. Now, let's talk about a lack of a plan. Anaesthetics do not form part of this recruitment strategy. The same branch I told you had 2,000 vacancies, they are the key to allowing both emergency and elective surgery to be performed. They are the first to get pulled into ITU with COVID numbers surging and most likely to suffer burnout. But they are not deemed worthy of being part of a coherent recruitment strategy. There is no plan here. I asked the Cabinet Secretary for Health to tell me about his redesign of the referral pathways, and the Cabinet Secretary proceeded to tell me about the diagnostic centres opening up in 2025-2026, with one perhaps in 2022. This is not detail, but simply rhetoric. Where is the detail on the design? The NHS Recovery Bill set up a vision for the future, but it neglects us today. Let's look at the social care element. I have a patient who has home help, but her carers are frustrated because they don't have enough time to do the things they want to do for the lady. The scope of the redesign is too big. It will take too long to get everything organised and set up. I implore the government to get help to where it is most needed, and then we can get about doing more. Do I have hope that this will be implemented and delivered on time? Ferries, superfast broadband, taking responsibility for 11 devolved benefits, all delayed and full of broken promises. So I have little hope. Look, we can all agree that COVID has hit us hard, but morale was at an all-time low before COVID. Now, the Medical and Dental Defence Union of Scotland is telling us most GPs and dentists are thinking of leaving the profession. Morale really is at rock bottom. And yet, apparently, the First Minister and Cabinet Secretary for Health say we are not at a crisis. Record A&E wait times, ambulances queuing around the blocks, record waiting lists, cancelled surgeries, GPs' demands at record levels. Yesterday, I had 80 patient contacts in my surgery. 80! This is not sustainable. If this is not a crisis, I do not know what a crisis is. Ladies and gentlemen watching at home, we are in a crisis. But perhaps to paraphrase JFK, the Chinese have two brushstrokes for the word crisis. One that means danger, and the other that means point of change. And I hope this government can finally admit that we are in crisis. The NHS is in danger. Accept this. We are here to work across the floor to create a plan and provide expertise to really deliver a workable solution for Scotland. But please focus on today and help the people now.
Thank you. I now call Gillian Mackay to be followed by Christine Graham. Up to 4 minutes. Point of order, Stephen Kerr.
Right, that if a member takes an intervention, they are not getting any time back. For clarity.
That is a matter for the Chair. I would also just add, by way of clarification, there isn't any time. I think the previous PO and the Chair made that clear. And we're trying to allow everybody to have their 4 minutes, because there could come a point where that may not be the case if we have lots of extensive overruns on each member's speech. Thank you. Gillian Mackay, up to 4 minutes, please.
Thank you, Deputy Presiding Officer. I too would like to extend my sincere thanks to our health and care workers who are working so hard to keep us safe and well. They've been going at a superhuman pace throughout the pandemic, and I can only imagine how exhausted they must feel. It's only right that we take every opportunity to express our gratitude and appreciation for everything that they do. If my amendment had been selected, it would have focused on mental health. We know that the pandemic has had a devastating impact on our collective mental health, but we have not all been equally affected. The most recent report from the Scottish Government's COVID-19 mental health tracker study found that young adults, women, people with physical and/or mental conditions and people in a lower socio-economic group are more likely to report experiencing poor mental health. The Scottish Government's mental health strategy was published in the time before COVID-19, and we have to recognise that circumstances have materially changed since then. That's why I welcome the Government's commitment to publish a refreshed mental health strategy and a mental health workforce plan as part of its agreement with my party. It is, of course, vital that the refreshed strategy takes account of how some people have been disproportionately affected by COVID-19. It must consider the social determinants of mental health if it is to effectively address the huge rise in mental distress caused by the pandemic. Non-communicable diseases post-pandemic also need to have more of a focus as we begin to emerge from the worst of the pandemic. Smoking and drinking rates amongst the biggest smokers and drinkers have increased over the pandemic. We need to prioritise good health for our nation, improving outcomes through reducing poverty, improving access to food and reducing availability of health-harming products. No company should be allowed to profit from damaging other people's health. This session has the ability to be the public health parliament, and I do hold on to the hope that we can work cross-party to achieve this. I would now like to focus on social care. The Scottish Greens and the Scottish Government are committed to ensuring that the National Care Service upholds the principles of fair work, which is why we've committed to a system of national collective bargaining on pay, terms and conditions within the social care sector, so that we can build on all care staff receiving the minimum wage as the living wage as a minimum while working to a higher rate of pay, and improve access to training. Very briefly, yeah.
Paul O'Kane. Thank you, President Officer. Very briefly, the Scottish Greens committed to £15 an hour in their manifesto in terms of care workers. Are they still committed to that position, given they are now in government, and will they support Labour's amendment today?
Gillian Mackay.
I personally am still very much committed to working to £15 an hour. I'm still committed to it.
Ms Mackay, you don't have that much time left, so please.
We also want to better recognise the contribution of unpaid carers, without whom our social care system simply could not function. Almost two-thirds of unpaid carers have been unable to take a break from their caring role since the start of the pandemic. Too often, unpaid carers become worn down and exhausted due to inadequate support and may even be forced to neglect their own health. This is why the Scottish Greens and the Government are committed to introducing a guarantee of short breaks and flexible healthcare appointments for unpaid carers. We will also ensure that care workers and unpaid carers can access bereavement services whenever they need to, so that they are not left unsupported at one of their greatest time of need. I'd like to end my speech by focusing on the NHS Recovery Plan, and I welcome its publication, along with the acknowledgement that the pandemic has placed our NHS under severe pressure and there is much more work to be done to help it recover. But I do have concerns about workforce shortages undermining the plan's ambitions, and I'd like the Cabinet Secretary to reflect on that in his summing up. And I'll stop there. Thank you.
Thank you. I now call Christine Graham to be followed by Katie Clark. Up to 4 minutes, please, Ms Graham.
Thank you, Deputy Presiding Officer. Can I put on record my thanks to all working at the Borders General Hospital, primary care services across Midlothian, South Tweedale and Lauderdale, my constituency, the GPs, the pharmacists and others, the ambulance services and the first responders. But I want now to focus my short contribution on the care sector. Those delivering it at home and in residential settings. This horrid pandemic exposed as never before that this is a Cinderella service with low pay, low regard, from people serving and caring with kindness and skill, the most vulnerable in our society. None of us in this chamber, or generally society at large, is innocent of taking those care professionals for granted. I therefore welcome the Feely report with the creation of a national care service, the scrapping of non-residential care service charges. In fact, I was here, when wasn't I, in 2002, when we introduced free personal care for the over 65s, limited though it was, and introduced in Scotland, though not in England, and also here when the Franks Law was introduced, I think just fairly recently, which extended that to the under 65s. I also was here when the integrated joint boards were launched to ease the movement and transition from hospital to home. This is an extremely difficult nut to crack, but a start has been made. Money was wasted. I haven't got time, very sorry, only got 4 minutes. I recognise too the Fair Work Convention's report into social care, with work taking place to embed fair work principles for the social care workforce, leading to better terms and conditions. I would also like to see more publicity to the existing courses where someone can transition from the care sector through to nursing through college courses, so there is a progression, a professional progression for them. But what must be heard in all of this is the voice of the carers and those they care for, not just heard, but heeded. Like many, I was extremely moved by the clap for carers on Thursday evenings when the tenements around me echoed with the cheers, the rattling of pots and pans and whistles, and even the occasional bagpipe. But being moved is not enough. I, like others, want to see more than recognition, but pay, which better matches their skills and commitment and recognises their duty to the job, that this, caring for the most vulnerable, is a vocation. That would be a good place to start. We all, for generations, left much of care of the elderly in residential settings to the commercial sector and companies, some good, some bad, just as when it's been in the local authorities, it's been some good, some bad. It's time we made sure that our very elderly, I may have to declare an interest, are cared for properly when they come to the end of their years. Thank you.
Thank you. I now call Katie Clark to be followed by Emma Harper, who will be our last speaker in the open debate. And Ms Clark, up to 4 minutes, please.
Thank you, Deputy Presiding Officer. And I would like to add my voice to the tributes to all NHS and social care workers. In the short time available, I'm going to focus on the National Care Service. It is right that we recognise that social care is an essential component of the welfare state, like the health service. And there's much which is positive about the proposals from the Scottish Government. But my concern is that they are for a National Care Commissioning Service, not a National Care Service, and that they will lead to a huge rise in the amount of tendering and a further centralisation and erosion of the power of councils. The idea of the National Care Service was, of course, modelled on the NHS. The NHS employs doctors, nurses, lab technicians, porters, cleaners and many others. It provides a service. A considerable amount of effort has gone into stopping it being privatised. This National Care Service proposal will not employ care staff, but will commission services from the private sector, the third sector, and presumably the public sector too. It is not clear that the public sector, such as councils, will even have preferred bidder status. Last year, the First Minister said she supported calls to remove the profit motive from the care home sector. This consultation, however, does not mention the word profit once. There is no acknowledgement within the consultation that the private sector's explicit obligation is primarily to shareholders, not to the needs of residents. Within these proposals, outsourcing is encouraged. Nothing is done to challenge the current private sector-dominated model. So I have a number of questions I'd like to put to the Minister. Are there any companies currently delivering care who won't be allowed to bid under the new care system? An investigation by the Ferret in 2019 found at least 44 Scottish care homes were owned by companies based in tax havens such as Jersey, the Isle of Man and Gibraltar. Will the Scottish Government follow the example of countries like Denmark and ban offshore ownership? The Scottish Government proposes extending the scope of the National Care Service to children's services, community justice, alcohol and drug services, social works, an element of mental health services. Can I ask the Minister, will these be open to tendering processes too? And will the Scottish Government legislate to ensure that no contracts will be awarded to companies that fail to recognise trade unions or do not apply union-negotiated rates of pay in line with the demands from the Scottish Trade Union Congress? The principle of setting up a national care service that operates like the NHS is right. And as I say, there is much that I hope will be very positive in the proposals that the Government is coming forward with. But as they stand, the Scottish Government proposals do not deliver a national care service that it will be delivered in the public sector, that will be free at the point of use. And I believe that that is the kind of social care service that we should be continuing to campaign for.
Thank you. I now call Emma Harper, who, as I said, will be the last speaker in the open debate. Up to 4 minutes, please, Ms Harper. Thank you.
Thank you, Presiding Officer. I welcome the opportunity to speak in this debate on recovering, remobilising and renewing health and social care in Scotland. I want to include my immense and sincere thanks to all our health and social care staff in Scotland who are working flat out every day under intense pressure due to the pandemic. I remind Chamber that I am a nurse and I'm about to join the flu and COVID vax programme locally just in the next week. And over the last 18 months, the NHS colleagues and health and social care staff have really stepped up in the face of COVID-19. Many of my colleagues and NHS contacts are feeling undervalued. There are many reasons for this. Could be part of the fatigue that everybody's feeling. But I know one reason is that all of the work being done in healthcare prior to COVID and now dealing with COVID is driven by evidence and scientific informed research. Science must be valued, research must be valued. The health care and medical experts, our GPs and consultants in acute care must all be valued by all of us, politicians, media and members of the public. So I would ask the Minister in his closing to provide assurances that the professionals are valued, that their knowledge, their expertise, the scientific evidence and the input will continue to be considered when tackling COVID and when future healthcare decisions are made. Presiding Officer, the Scottish Government's NHS recovery plan is backed up by more than £1 billion of investment over the next 5 years. It is imperative to ensure that people receive care, including some cancer screening and non-elective procedures, which were paused during the pandemic. Alistair Allen mentioned the investment in national treatment centres of £400 million, contributing to the delivery of over 40,000 additional elective surgeries and procedures each year. This includes the new fast-track diagnostic centres, including one of them in NHS Dumfries and Galloway, which was opened in June. The plan also provides £8 million to support the mental health and well-being of our health and care workforce, and mental health support has already begun. This includes access to counselling, support for managing stress and support for optimal work practices. On mental health, it is extremely welcome and right that there is a focus on ensuring the well-being of young people is supported. And through my own casework, I know how pressed CAM services are and how this can have a negative effect on young people. They have had a particularly challenging 20 months so far. They've had to adapt to homeschooling, haven't been able to partake in usual activities, and this has had an impact on their well-being. So ensuring that at least 10% of frontline health spending is dedicated to mental health and recruiting 320 additional child and adolescent mental health service workers is therefore needed, and it's welcomed by SAMH's charity. Presiding Officer, the NHS Recovery Plan commits £130 million to delivering Scotland's National Cancer Plan. And while this, along with the commitment to re-establish a national centre of excellence for remote and rural medicine, is great to hear, I would like to touch on the modernising patient pathways work, which has been taken forward as part of the recovery plan. The programme will look at cancer pathways, and I would ask the Health Secretary to commit that this work will ensure that no patients in D&G, including in Wigtonshire, will make unnecessary travel to Edinburgh for treatment when Glasgow is closer. Presiding Officer, there is so much to welcome in the Government's recovery plan, including an increase in funding for primary care, for GPs, allied health professionals, that's worth over £12 million, and improved training and systems to enable more efficient triage of patients. Most importantly, this plan does set out the foundation for establishing a national care service, which others have touched on today, but due to time, I will not. In closing, Presiding Officer, I want to again welcome this plan and look forward to it progressing. Thank you.
Thank you, Ms Harper. We now move to the winding up speeches. I call on Willie Rennie to wind up for the Lib Dems. Up to 4 minutes, please, Mr Rennie.
Thank you, Deputy Presiding Officer. It was an extraordinary start to this debate. We were told that this was supposed to be the introduction of the central reform of this Parliament, the creation of a national care service. But the Health Secretary hardly mentioned it at all in his opening contribution. If this is going to be such a major change in this Parliament and to the way that the social care service is run, it deserves to be better led than has just been done in this debate. It's no way to lead a major reform. There have been some excellent contributions in this debate. Sandesh Gohani, who set out from great experience the difficulties the long-standing difficulties that we see in the NHS now, that were there before the pandemic, which meant we weren't ready for the pandemic when it came, and now we're suffering the consequences of it. As Jackie Bailey set out, the long waits to get treatment. Craig Hoy, again, very good contribution, setting out in detail some of the problems around about diagnostics, the legally binding treatment time guarantee that hasn't been met for years, way before the pandemic, and obviously accident and emergency waits as well. And Carol Mochan, but also Gillian Mackay, set out the problems with mental health services that my party has been dedicated to reforming for some years, but yet we have not seen the improvement that I think we deserve. Yet this government, with this backdrop, with this years of failure on the NHS, thinks that it is best placed to take control of the care service of this country as well. I think it should sort out its own problems before taking on other people's problems. The government is exhibiting typical avoidance behaviours. It's avoiding the big central problem, in a second, the big central problems of the care service. As Jackie Bailey rightly says, it's more about culture than it is about organisation. She's right about that. But this is the third major bureaucratic reorganisation in just 20 years of this Parliament. We started off with joint futures. Then we had the IGBs and the health and social care partnerships. Now we've got central control. None of the other reforms in terms of big bang reorganisation made any great difference. So I'm not sure what the government thinks is going to make a difference this time round. The Minister said, and I'll take him in a second, he said that actually the current structure was preventing him from paying health and social care staff properly. That is utter nonsense. If the government wanted to pay health and social care staff more, it could do it right now. There is absolutely nothing preventing it from doing so. I'll take an intervention from the
Cabinet
Minister.
Secretary.
Well, I just wanted to intervene on the point where he said he thinks the Scottish Government are best placed, or we think the Scottish Government are best placed for the creation of a national care service. We do. But does he not recognise we were also given a mandate by the people of Scotland who voted for us for the fourth time? I know sticking to manifesto promises is not his strong point, but does he recognise it was in our manifesto and therefore we have a mandate to take that forward?
Willie Rennie.
When the Minister gets cheap, it knows that he's not got an argument to justify his case. And that is the case this time round as well, because we've seen with the centralisation of the police, if that wasn't the biggest warning that this government should heed, I don't know what more would be. Big bang reorganisation done in a rush to solve a problem that they don't have the actual solutions for. Consequences are quite severe. Political decisions have consequences, and we need to be incredibly careful about that. Alex Cole-Hamilton rightly set out that this is a cynical attempt by the government to try and compare its reforms with the creation of the National Health Service. But the National Health Service was free at the point of delivery. This is just a central power grab and nothing more. And the government should do better at setting out its case than the pathetic attempt it's made today.
Thank you. I now call Paul O'Kane. Up to 6 minutes, please.
Thank you, Deputy Presiding Officer. And I want to begin with a common thread that's run through our debate today and do what colleagues have already done and thank all of our hard-working NHS and social care staff for all they have done and all they will continue to do. They have worked hard on the front line, caring for us all, caring for the sickest people in Scotland, keeping services going in an unimaginable set of circumstances. And of course we owe them our deep gratitude. But as we have heard this afternoon, warm words of thanks aren't enough. Words won't solve the crisis in A&E, where people are waiting on average 6 hours for an ambulance. Praise from ministers won't address the over 600,000 people waiting for treatment or diagnosis. And applause doesn't make a £15 an hour wage for care workers a reality. And a government motion and thin recovery plan that fails to recognise the scale of the crisis is cold comfort to those who know what is happening on the ground, the doctors, nurses, healthcare assistants and support staff, who, as we have heard already today, have used words like exhausted, undervalued and burnt out to describe their day-to-day experience. Now, I know that ministers and members on the SNP benches are quick to retort, saying that these are unprecedented times. Of course they are. Indeed, the Cabinet Secretary continually cites the pandemic as he seeks to justify the variety of very serious and imminent challenges which have been referenced in today's debate. But, Presiding Officer, he refuses to acknowledge what not just we in this Parliament are saying, but what professionals, patients and carers tell him, that this is a crisis which has been growing since before the pandemic and has been exacerbated by it. My colleague Jackie Bailey spoke about the stress of people waiting on waiting lists, 400,000 people languishing on waiting lists pre-COVID-19. And the BMA in Scotland have been warning about workforce pressures in the healthcare sector since before the pandemic, as was mentioned by Craig Hoy. Before the pandemic, ambulance turnarounds were taking longer, with 17,926 turnarounds taking over an hour, a shocking increase of 634.4% since 2014. So how can the government be taken seriously when it talks about a planned recovery, but refuses to admit that this crisis has been unfolding under their watch for 14 years? And on the recovery plan, the Cabinet Secretary has been fond recently of saying that he doesn't have a magic wand when answering members' questions in relation to the issues. But I must say he's increasingly clinging on to his plan as though it might be. It's been described, though, as only a best start by Dr Lewis Morrison, Chair of the BMA, and further described as unrealistic and that it has a number of worrying gaps. And the RCN said that there is little detail in the plan on how issues such as staff burnout can be addressed. And they have warned that nursing is feeling undervalued and under-resourced for far too long. And as Sue Webber and others pointed out, it is time that the government showed how it will support and retain exhausted staff in the system at the moment. Deputy Presiding Officer, I wish to turn to social care. In 2011, Scottish Labour First advocated a national care service, and as my colleague Jackie Bailey likes to remind the government, we do welcome all converts, however late. But we have always been clear, and I think we have heard today from Willie Rennie and others, that it has to be about culture and not solely focused on structure. This National Care Service has to be about those who live in our communities and need access to the right care in the right place and the right time. And I think Claire Adamson was right when she spoke about rebuilding our communities better, in a sense. It must be about ensuring that older people are holistically supported as they live longer in our communities, and ensuring that care homes adhere to rigorous standards and are held to account for those to drive up quality and the training and retention of staff. It must be about ensuring that people who have learning disabilities can live their lives with choice and control and are not simply facing false choices with ever-diminishing budgets. People want a seat at the table where the decisions are made, carers want a voice at those tables, and those who use social care want a meaningful say in the decisions that impact them. And if the government insists on driving an agenda that's about drawing power towards the centre and doesn't recognise the importance of local decision-making, with people who use services having a say, then this will simply be upheaval and structural change with little real change on the ground. And the people of Scotland cannot wait 5 years for the Scottish Government to work out what the big vision is on a national care service. There is action that can be taken now, and action is needed now. Indeed, there are practical steps which Jackie Bailey alluded to, which will make an immediate difference to the lives of people in receipt of social care and those who support them. This includes restarting respite services and creating a plan around that, ending non-residential care charges, pausing commissioning, and addressing the poverty pay that we've heard about in the sector by supporting a pay rise for social care staff to at least £15 an hour. And I welcome Gillian Mackay's support of that, and that she has held true to the Green Manifesto, and I do hope she will influence her colleagues in ministerial office. Our social care workers, Presiding Officer, deserve more than warm words, and as my colleague Carol Mockin pointed out, they must be valued. The Government speaks in their motion of fair work, but they have failed to deliver. 1 in 5 workers are on insecure or temporary contracts, and 15% of staff work unpaid overtime. Once again, we from these benches call on the Government to give care workers the pay rise they deserve and show that they are valued. It is clear that after 14 years in power, the SNP Government has mismanaged the NHS, and we are facing a serious crisis before we even get to the crisis that winter will bring.
Mr Kane, would you bring your remarks to close, please?
Certainly, Presiding Officer. The Government is letting down health and social care staff, and if it is serious about the challenges that face Scotland, then it must show that it values every single member of staff in the NHS and create a plan to match. Thank you.
Thank you. I now call on Miles Briggs to wind up for the Conservatives. Up to 7 minutes, please.
Thank you, Deputy Presiding Officer. And can I, like others, start by saying thank you to all those who have provided care to our fellow Scots throughout the pandemic. And from the outset of this public health emergency, we have faced significant challenge and a negative impact on all our care systems across Scotland, but perhaps most importantly for those who provide unpaid care. And they, I believe, have been and should be at the forefront of all our concerns. So I'm disappointed that we've not really seen that outlined today by ministers. Because prior to the pandemic, there were an estimated 788,000 carers, including 44,000 young carers in Scotland. The COVID-19 pandemic has significantly increased the numbers of unpaid carers in our country, with social care support packages being cut or reduced, with reductions in respite care and the closure of childcare and school facilities. However, the pandemic has also resulted in the significant expansion of unpaid carers in Scotland. Research in June 2020 showed around 392,000 more people, more of our fellow Scots, 60% of which were women, had become unpaid carers, taking that to a total of over 1.1 million of our fellow Scots taking on a caring role in our society for a family member of loved ones. That is the group of people I believe this Parliament must be focused on, not top-down reforms. Unpaid carers have reported significant challenges, with nearly two-thirds highlighting the financial impact of additional costs and the impact on family budgets. And it's now estimated that the economic value of unpaid care in Scotland alone is estimated at an outstanding £37 billion of unpaid care provided. Now, I want to look at some of the consensus which I think we can find across the Chamber, especially around the development of a national care service, or standard, as I think we probably are all on the same page with. Because we do have the opportunity, coming out of the pandemic, to take forward a number of welcome reforms, and we in these benches have argued for them in committee and in the Chamber previously. The development of a national clinical standard for social care is long overdue, and something which I hope we will see work progress urgently on. And workforce planning is something which this Parliament has got wrong for too long, and the Scottish Government need to look towards how we make sure the workforce for social care is put in place, but also the career pathways are developed to make sure people can progress in their career choice, and to make caring that career pathway we all want it to see it be. And what would be unacceptable, and we've heard this from members across the Chamber, is if we are just about to see an SNP Green ministers look to take away all local accountability and undertake a power grab and removal of local decision-making and choice within care. The proposed scope of a National Care Service represents a significant expansion of the recommendations contained in the independent review of adult social care that has previously been outlined by the Scottish Government, and we've had no explanation today of why that has been and why this is going to be the case. Local government is only just starting to recover from this pandemic. Ministers have said previously that local government is crucial to COVID recovery, and indeed we hear ministers speak about community wealth building, where local authorities will be the ones who should be focused on partnerships and local spend of budgets. As Craig Hoy and Katie Clark both mentioned in their contributions, a total restructuring of social care in Scotland will be destabilising and present many significant challenges. Now, there's a number of questions which this debate has also brought forward, which I hope we will soon hear from ministers answers to. A National Care Service would see staff face a change of employer and terms and conditions around their employment and also their pension rights. Likewise, we've seen and heard no detail of what a National Care Service means for infrastructure in place. Council-owned properties, for example, and the procurement contracts in place today are currently legal binding documents. So how will these be unpicked? And that bureaucratic argument for councils to have to face is something I think ministers need to also start answering questions on. And above all, something which hasn't really been looked at is we've seen the integration of health and social care take place. What does that now mean? Is that a flagship project of this government, which they are now turning their backs on? Deputy Presiding Officer, Scotland's local authorities and our vital third sector have been quite simply outstanding during this pandemic. And the can-do attitude which they have shown to mobilise services for our fellow Scots has been invaluable during this national response. Are we truly now seeing SNP ministers saying to them that the centralisation of power and top-down reform is the thanks they can expect? Because during the pandemic, we have seen genuine partnership working. That partnership working now seems to be under real threat. And the SNP Green Coalition's centralising approach is clearly starting to generate serious concern across local government. It's little wonder that COSLA have described the Scottish Government's proposals as an attack on localism that could spell an end for anything other than central control in Scotland. These are real and valid concerns, and we have heard no answers today on any of them. Because the concerns of local government are not just simply dismissed by ministers, we're not hearing any opportunity for them to make sure that they are seeing their powers protected. To conclude, Deputy Presiding Officer, Scottish Conservatives believe that the local delivery and local accountability of our health and social care services is vital. We'll make sure, as these reforms are progressed and brought forward to Parliament, that Scotland's carers and our local councils quite rightly are at the heart of any national care service. I support the amendment in my colleague Craig Hoy's name. Thank you.
Thank you, and I call on Kevin Stewart to wind up. Minister, up to 9 minutes.
Thank you very much, Presiding Officer, and I would like to echo the thanks that many in this chamber have given today to the staff who work in our health and social care services. In particular, I'd like to thank Lisa and Jenny, nurses who I met at the CAM service here in Edinburgh today, and Emma Harper asked that we all ensure that professionals are valued. I tell you, Emma, that these professionals are so valued that I'm going to be speaking again very soon to Lisa to get even further insight into what they are doing there. I think we can all agree that our health and social care services are a lifeline to many. Our current system is under pressure, especially as a result of the pandemic. And I think it's quite sad that many folk today have not mentioned the fact that that pandemic is still ongoing, or the challenges that we have had to face because of that global issue. I would say, Presiding Officer, that recruitment and retention has been challenging for some time, and even more so in the last 18 months. And we're also seeing a greater demand in the system, and people with higher levels of need from acute and community offers than before the pandemic began. In the community, this has turned to increased pressure on unpaid carers, and I agree with Miles Briggs in that, many of whom are now desperate for a break. And the Government will work hard to address these issues, matching reform and recovery with investment. And I have to say that it is I'll give way to Alex Cole-Hamilton.
Alex Cole-Hamilton.
I'm grateful to the Minister for giving way. Does he recognise that one of the main reasons that unpaid carers are on their knees and in desperate need of respite because his government refused to allow adult respite services to reopen until now?
Kevin Stewart.
I have to say, Presiding Officer, that some folk try to avoid listening to clinical advice when it suits them. Many of the day services are now open. They are not up to full capacity yet because we are still following guidance that we have from the scientists and the clinicians. I'm more than happy to speak to Mr Cole-Hamilton or any other member about this, but you cannot have it always. We cannot have a situation where we could be accused of putting folk at risk if we were not to follow that advice. Presiding Officer, we cannot wait for a new National Care Service to be established to address issues. We will act now to improve services for the people who rely on them, for unpaid carers and for the people who work in our care services. We're taking action with local partners to address the immediate pressures on care-at-home services, which in turn are placing pressures on our NHS. And this includes establishing a dedicated web page for social care vacancies, making it easier for people to find and apply for roles in care. And we're also issuing targeted communications to nursing and social work students to encourage them to join the workforce. But again, the elephant in the room here, and if anyone wants to talk to any of the care providers, please do, is the amount of staff that have left because of Brexit, folk returning to their home nations. And that has caused us great grief, which those folks and those benches, Presiding Officer, will never admit. Presiding Officer, we've allocated an additional £380 million to health boards to help with costs arising from the pandemic this financial year. And this comes on top of the £1.7 billion already provided to health boards and health and social care partnerships last year. And we match our ambitions with further, we'll match our ambitions with further funding. We'll deliver a 25% increased investment in social care over the lifetime of this Parliament, equating to around £840 million. And that funding will provide better support for people who access services and better terms and conditions for the workforce. I'll take Pam Duncan-Glancy.
Pam Duncan-Glancy.
Thank you very much, Presiding Officer, and thank you, Minister. One of the things that's been highlighted to us by Inclusion Scotland is the importance of opening eligibility for social care, and they've said that the 25% increase may not be enough to do that. So will the government commit to increasing that, and also will the government also commit to living by its intention to support disabled people's independent living and the definition of independent living by ensuring that it is enshrined in the legislation to develop a national care service?
That is a huge amount for me to answer in a very short period of time, so I think I'll meet with Pam Duncan-Glancy about some of these issues. But let me tackle the eligibility issue, because I think the eligibility issue is one of the major difficulties that we have, which causes the postcode lottery in various parts of the country, and that's why we want to get rid of that, have national standards so folk know what they can expect and what they deserve, rather than that postcode lottery. Presiding Officer, I don't really have much time, I don't think. I'll maybe take Mr Briggs very briefly.
Thank you.
Miles Briggs.
I thank the Minister for taking this intervention. As a former Aberdeen City Councillor, what does he say to the President of COSLA when she refers to, and he hasn't touched upon, the National Care Service as an attack on localism? Does he agree with that point?
Minister.
I agree with that point, and I'll come to that later on in my speech, Presiding Officer. I want to turn to the workforce because I think that's immensely important. And improving terms and conditions will improve the experience of the current workforce and also help attract and retain new staff into the sector. And we will work with COSLA and we will work with sector stakeholders through the Fair Work and Social Care Group. Through that, we have developed already a set of standards for terms and conditions that promote flexible and family-friendly working. And we have maintained our commitment to adult social care workers, ensuring that they are paid at least the real living wage. The Government is providing £64.5 million of funding this year to do so. In his last minute. And we recognise that we need to go further. There is absolutely no doubt about that, and we will go further. And our ambition is also to bring the pay, terms and conditions of nursing staff working within the care sector in line with those in the NHS, and we'll review options to achieve this. We recognise the challenges and the complexity of delivering this across a varied landscape of over 1,000 unique providers. However, the Scottish Government will push for a national wage for care staff and enter into a national pay bargaining for the sector for the first time. And it's vital that unpaid carers are recognised as equal partners in care and are able to take breaks to protect their own well-being. And that's why we're consulting on enhanced rights to breaks from caring alongside the creation of the National Care Service. We are proposing the biggest public sector reform for decades since the creation of the National Health Service. With the consultation for a National Care Service underway, we're having open and honest conversations about what people want the future of social care to look like. And I would encourage everyone to get as many people as possible to respond to that consultation. We have also created a group of people with experience of social care to hold us to account if they don't think that we
If the Minister could wind up, please.
Yep, putting people at the heart. The Social Covenant Steering Group is going to be immensely important and will put human rights right at the very heart and drive up standards right across the country. Presiding Officer, local accountability will be key to ensuring this works for people. Under our proposal for community health and social care boards, we will see for the first time people with lived experience sitting on boards alongside locally elected members and health and social care professionals. This is bringing those with lived experience into the decision-making process, which is absolutely vital. Finally, Presiding Officer, from the rubble of World War II, our respected NHS was born. And as we emerge from the shadow of COVID, we can build a national care service that we can be proud of, that delivers for our people. Thank you.
Thank you. It's now time to move on to the next. Point of order, Sandesh Gilhani.
Just for the record, I forgot to declare my register of interest, which is I'm a practising doctor.
Thank you, Mr Gilhani. I appreciate your point of order, which is noted. It is now time to move on to the next item of business, which is approval of an SSI. And I ask Ben Macpherson to move motion 1219 on approval of an SSI.
Formally moved, Presiding Officer.
Thank you. The question on this motion will be put at decision time. There are 5 questions to be put as a result of today's business. I advise members that if the amendment in the name of Craig Hoy is agreed to, then the amendment in the name of Alex Cole-Hamilton will fall. And the first question is that Amendment 1190.3 in the name of Craig Hoy, which seeks to amend motion 1190 in the name of Humza Yousaf on a caring nation, recovering, remobilising and renewing health and care in Scotland. Are we all agreed? Yes. The Parliament is not agreed, therefore we will move to a vote and there will be a short suspension to allow members to access the digital voting system. Thank you. I remind members that if the amendment in the name of Craig Hoy is agreed to, then the amendment in the name of Alex Cole-Hamilton will fall. The first question is that Amendment 1190.3 in the name of Craig Hoy, which seeks to amend Motion 1190 in the name of Humza Yousaf on a caring nation, recovering, remobilising and renewing health and social care in Scotland, be agreed. Members should cast their votes now. The vote is now closed. The result of the vote on amendment number 1190.3 in the name of Craig Hoy is yes 33, no 66. There were 21 abstentions. The amendment is therefore not agreed. And I remind members that if the amendment in the name of Jackie Baillie is agreed, then the amendment in the name of Alex Cole-Hamilton will fall. The next question is that Amendment 1190.2 in the name of Jackie Baillie, which seeks to amend Motion 1190 in the name of Humza Yousaf on a caring nation, recovering, remobilising and renewing health and social care in Scotland, be agreed. Are we all agreed? No. The Parliament is not agreed, therefore we will move to a vote and members should cast their votes now. The vote is now closed. Point of order, Michael Mara.
Presiding Officer, my app wouldn't refresh, but I would have voted yes.
Thank you, Mr Mara. That is recorded. The result of the vote on amendment number 1190.2 in the name of Jackie Bailey is yes 21, no 100. There were no abstentions. The amendment is therefore not agreed. The next question is that amendment 1190.4 in the name of Alex Cole-Hamilton, which seeks to amend motion 1190 in the name of Humza Yousaf on a caring nation, recovering, remobilising and renewing health and social care in Scotland be agreed. Are we all agreed? Yes. The Parliament is not agreed, therefore we will move to a vote and members should cast their votes now. The vote is now closed. The result of the vote on amendment number 1190.4 in the name of Alex Cole-Hamilton is yes 54, no 66. There were no abstentions. The amendment is therefore not agreed. The next question is that motion 1190 in the name of Humza Yousaf on a caring nation, recovering, remobilising and renewing health and social care in Scotland be agreed. Are we all agreed? The Parliament is not agreed, therefore we will move to a vote and members should cast their votes now. The vote is now closed. The result of the vote on motion 1190 in the name of Humza Yousaf is yes 67, no 32. There were 21 abstentions. The motion is therefore agreed. The final question is that motion 1219 in the name of Ben Macpherson on approval of an SSI be agreed. Are we all agreed? Yes. The motion is therefore agreed. That concludes decision time. We shall move on to members' business, and I ask members who are leaving the chamber to do so quietly.
The Catalans, the Basques, the Galicians in the Basque.
An independent future for Scotland.
How quickly do you think a referendum can be arranged?
Best practice demands that it should be 6 months.
Just looking at the overall share numbers for Scotland at the moment, the SNP 46.4%.